the fact that it's a little bit more difficult than when we're all physically present in the room. So just ask for your cooperation on that. I now call on the Controller and Auditor General, Mr. Seamus McCarthy, for his opening statement.
Thanks, Chair, and good morning. Very briefly, the appropriation account for Vote 38 Health records gross expenditure of €20.8 billion in 2020. This represented a 19% increase on the gross expenditure of €17.5 billion incurred in 2019. The majority of the gross expenditure in 2020, just under €20.5 billion, was paid to the HSE. This was spread across 14 subheads in the account. Other subheads of the vote provided for payments of grants and other support to bodies under the aegis of the department, and funding for the National Treatment Purchase Fund and Sláinte Care initiatives. Receipts into the vote in 2020 totaled €488 million. These comprise mainly €270 million recovered in respect of the cost of providing health services to EU nationals under EU regulations, and receipts of €168 million from the proceeds of excise duties on tobacco products. At year end, net expenditure under the vote was €120 million less than provided for. With the agreement of the Minister for Public Expenditure and Reform, €68 million in unspent capital allocations was carried over for spending in 2021. The remainder of the surplus for the year, €52 million, was liable for surrender to the Exchequer. Finally, I issued a clear audit opinion in relation to the appropriation account.
Thanks, Seamus. Now, just ask Mr. Watt for his opening statement. And generally you have 5 minutes, but look, you have supplied a fairly concise statement, so you're very welcome. So you proceed, Mr. Watt. You're just on mute there. Yeah, you're okay.
Yeah, sorry. Good morning, and good morning, members. Good to join you this morning. So I have a brief statement, as mentioned. So as accounting officer for the Department of Health's Vote 38, I'm pleased here today to discuss the 2020 annual report and the appropriation account of the Controller and Auditor General. I'm joined by several colleagues, Kevin Coleman and Mr. John O'Grady from the Resources Division, and Ms. Fiona Lartwell from the Social Care Division of the Department. I will now set out the main accounts briefly for 2020 as they pertain to Vote 38. The initial 2020 net provision current and capital for Vote 38 was $17.9 billion, which consisted of a gross provision of $18.3 billion and appropriations of aid of $430 million. As the scale of the challenge presented by COVID became clear during the first quarter of 2020, it was evident that unprecedented action was needed here in Ireland to prevent the spread of the disease, the high rates of hospitalisation and intensive care admissions, and significant mortality. New structures and processes were put in place between the Department of Health and the Department of Public Expenditure Reform and the HSE to facilitate timely decision making, while also ensuring that high level of governance were maintained, where the HSE reported to the Department each week and the estimated COVID-related spend as it evolved had been incurred to date. Additional funding of just under $2 billion, $1.997 billion, was voted to the Department in a revised estimate of June of last year to support the measures outlined in the action plan for COVID-19. This represented the expenditure approved by the government for COVID-19 measures taken up to date and the passing of the revised estimate. A further net supplementary estimate of $514.5 million was approved to meet additional funding requirements that arose up to the end of 2020. As the Controller and Auditor General has said, this resulted in a net overall position for Vote 38 of $20.44 billion, incorporating a deferred capital surrender of $30 million carried over from the preceding year, 2019. The 2020 outturn was $20.3 billion, leaving an overall surplus of $120 million. The Department of Health received sanction from the Department of Public Expenditure Reform to carry forward $68.2 million of unspent allocations in respect of capital elements of subhead M2 into 2021. The pandemic, as members are aware, has been an extremely difficult time for frontline employees and workers in the health service. They have responded with diligence, resilience, agility, and a level of commitment which has been extraordinary. With the support of the Department, And the government, the HSE, has introduced new capabilities and innovations across the system. These include implementing e-prescribing in general practice and introducing alternative care pathways and new models of care. An example of the innovation of the health system was seen in responding to COVID last year. New testing and contact tracing capability was implemented with the delivery of 720,000 GP referrals, 2.3 million laboratory tests, and over 440,000 contact tracing calls during the year. We have implemented a hugely successful COVID-19 vaccination strategy, one of the highest levels of uptake in Europe, and are making very strong progress in delivering booster vaccines across the population. Further investment in the overall reform of our health system includes very significant investments in clinical strategies, such as cancer, gynecological and maternity strategy, coupled with an unprecedented investment to address the shortcomings identified by the 2018 capacity review, which is seen as deliver the largest increase in our acute and critical care beds and also in our community beds in decades. Allied to increasing acute capacity, we're also undertaking a critical shift left in moving care out of acute settings and into the community, with the recruitment of an additional workforce of over 3,000 to implement community care networks across every community in Ireland. The Department has continued to successfully discharge its other functions. Importantly, we seek to frame policies and legislation to promote health. The life expectancy in Ireland is now estimated at 82.8 years, which is above the EU average of 81 years. However, with the prevalence of preventable non-communicable diseases, it is hugely important to promote healthy behaviours and preventable health. Under the Healthy Ireland umbrella, which is the objective of Government of Ireland initiative, we work selectively to achieve this objective. We also support Minister Donnelly and Ministers of State in their work, including their legislative priorities and their public and parliamentary accountability. For example, in 2020, the Department processed over 9,224 parliamentary questions, representing 24%, almost a quarter, of all parliamentary questions tabled to ministers across the entire government system. The Department continues to enhance its governance and performance oversight in respective services and reform being delivered by the HSE. In line with Sláinte Care, legislation was enacted in 2019 to introduce new accountability structures in the HSE, with the formal appointment of a non-executive competence-based governing board. In recognition of these new structures, the Department put in place a revised engagement model with the HE and its board with a view to strengthening the oversight of governance and performance management and accountability of the HSE. This oversight model is operational and will continue to be improved and enhanced as necessary to ensure there's more effective oversight within the government. This improvement work continues. The government has committed to bring forward regional health areas. A business plan for the implementation of regional health areas has been developed by the department. The HSE has provided feedback and implementation considerations on this business plan. A memorandum for government on the next steps for implementation is being drafted, and I anticipate the Minister will bring this memo to government for decision in January of next year. To ensure that we have frontline and expert input as we move forward, the Minister established an advisory group. Given this progress, the Minister has informed the Hospitals Group Board they're being stood down this month as their term of office expires. There are many improvements and reforms taking place which are providing better healthcare to our citizens, and together with our colleagues in the HSE, we are focused on further reforms in 2022. Finally, if I may, just thank the staff in the Department of Health for their ongoing commitment and dedication to our work programme across many different dimensions of our work. And finally, I look forward to working with the committee and the Oireachtas, and I'm happy to take any questions.
Thank you. Now, the lead committee member today is Deputy Imelda Munster, who has 15 minutes, and the next speaker is Deputy Nessa Harrigan, who along with all others will have 10 minutes. If time allows, and I ask people to keep the time, we'll allow members back in for a second round. I'll give you a reminder when you have 2 minutes left. So, Deputy Munster, proceed.
Okay, thanks, Chair, and good morning to all. I'll direct my questions to Mr. Watt, if I may. I want to touch first on the National Children's Hospital. In July, an official from your department told this committee categorically that they'd not considered costings of $2 billion for the hospital. But 3 weeks ago, the Minister for Public Expenditure refused to rule the $2 billion out, and the Irish Fiscal Advisory Council have also provided an estimate in excess of $2 billion. Have you to date considered such a figure, and is such a figure referenced in the report that you have that we've requested?
Thanks, Deputy, for the question. I think we've provided very detailed notes and briefing on this matter. I know the committee has considered it several times before. So we've set out very clearly what we think the estimate is for the hospital and for the related satellite works and the integration works. And we've also identified that there is a risk, a significant risk, given the delay in the project. So the project is delayed, as you know, likely into 2024 now, and that would increase the cost of the project. There are ongoing issues now in relation to construction inflation. The contract stipulates that inflation above 4.5% in 2019, that there will be further claims in relation to that. And there are ongoing claims and disputes between the contractor and the board. So there is uncertainty around what the final figure is, and we've set that out. So we don't at this stage have any update on the figure that we put out there in the public domain, but there is risk, and there's heightened risk about that estimate for the reasons that I've set out in the note that I forwarded to the committee, and that which we outlined before.
Okay, thanks. And just to get back to the question about the 2 billion, is that figure referenced at all within the report that you have?
No, like we're not. As you said previously, we're not speculating. We don't think there's any benefit in us at this stage speculating on what the estimate will be, the final figure. We know that there are pressures, and we've said that repeatedly.
Okay.
But we're not going to. And I understand that there's this legitimate request for certainty around the costs, and for the committee in terms of discharging your role to have a latest view on what if there's going to be a cost increase. But against that, we have to manage the state's interest and the taxpayers' interest, and that's why we're.
The reason I asked you, Mr. Watt, is both the department and yourself and the board of the National Children's Hospital have both written to the committee indicating that you'd be able to discuss updated costings once a report was completed. Now, that report is with yourselves. Can you provide us with that report?
I can of course provide it to you, but I've said repeatedly that I don't think that's something which is going to represent the interests of the taxpayer or the state.
Well, from the point of view of a Public Accounts Committee, I mean, I think you have the report since May, is that right?
Yeah, there are iterations of the report, yeah, and it has evolved, but it's been in final form or close to final form for a while now, yes.
Yes, but you received it in May. You confirmed to the committee that you received the report in May. Yeah. The other thing is just in relation to, can you give absolute confirmation that you'll forward that report to the committee?
No, I can't, Deputy. I think ultimately it's up for yourselves, and it's up for the government. If the Taoiseach and the Minister for Full Expenditure Reform and the Minister for Health want us to send the report, and if the Public Accounts Committee believe this is a sensible thing to publish this report, if this is the public interest to publish this report, well, then I would do it.
You'd imagine from a public purse perspective that would be of interest to publish the report.
It would definitely be of interest, but it's not in the interests of the taxpayer to provide information out there which might undermine the ability of the board to argue against the various claims and to negotiate the completion of this project in a way which minimises the cost of the exchequer.
Okay, so just to be clear, just to be clear, you're refusing to furnish the report to the Public Accounts Committee, and you're refusing to give us an updated costings, because I'm wondering why you yourself had actually said that you'd be able to discuss updated costings once you received the report. You have the report since May. You've thus far refused to furnish us the report, and now you can't even confirm costings. When you said to us that you'd be able to discuss the updated costings, was that a stalling tactic?
So, Deputy, I don't wish to get into an argument about it. Ultimately, it's my role to protect the interests of the taxpayer.
Now, and it's our role too.
Yeah, but if the PAC are willing to take the responsibility that something will be put in the public domain which will undermine our ability to defend the state's interests and to finish out this contract in the most efficient way. And if that's the view of the PSC, if that's the view of the CNAG,
well,
that's the view of the government, that's the view of the government, well, then I will do what I'm told. But it's my professional view, Deputy, for what it's worth, and people can dismiss this if they wish. My very clear advice and my very clear view is that publishing commercially sensitive information at this stage in a contract which is subject to dispute would be very damaging for the state's interest. Now, people can take a different, and ultimately, if I'm instructed to send this report against the advice that I've been received, if I'm instructed to do that, I would absolutely do that. So it's not a question for one moment that I'm refusing. And if yourself,
who advised you not to send the report to PAC?
So it's it's not to send the report to PAC. You said on
advice you received.
Yeah,
who advised you not?
The professional advice of people within our department. I mean the development board who are charged with managing.
But you're head of your department, so was it you ultimately that made the decision not to furnish the Public Accounts Committee?
Yeah, ultimately I'm responsible for the decision.
Could you provide it confidentially to Public Accounts Committee? Surely you wouldn't have an issue with that.
And who's going to take responsibility for ensuring this information stays private?
So the Public Accounts Committee will take responsibility. I mean,
are you going to take responsibility for a bid? Are you going to take responsibility for a bid leak, though, Deputy?
Sorry, just let me make the point. You argue that you're interested in protecting the state's interest. Now, surely, you know, if we're looking at costs in excess of 2 billion, it's in the state's interest and it's public money to know exactly what this hospital is going to cost and if it's going to be the most expensive children's hospital in the world. So I'll ask you again, will you provide the report? If you're refusing point blank to publish it, will you provide the report to the Public Accounts Committee as we've requested for some time now, and you've had it since May? That's a yes or no response, by the way.
If the decision is that we are happy to take the risk that the ability of the state to deliver on this contract, if it is the view that the ability of the state,
the view of who?
Well, the view. If I think for us. For me to publish this report or to send it to yourselves, I think I would need to have very clear instructions that the government and yourselves are happy to take the risk that this information will then be made available.
Okay.
Will then be I don't think I understand your need for transparency. I understand your role absolutely, but I think there's another view here which has great validity. Okay, and I think the PAC has a role in terms of value for money and ensuring that taxpayers' money is
know all that.
But you're asking me to do something which we think will not enable us to discharge our basic mandate to protect the interests of the state.
Okay, so you've made the decision not to publish the report. You're also saying now that unless you get the go-ahead, I presume it's the go-ahead from the Minister, to furnish us with the report confidentially.
I think.
Who are you looking to get permission from?
I'm not looking to get permission from anybody.
Right. So can you then, if it's yourself that decides, can you furnish the report confidentially to the Public Accounts Committee? Yes or no, please?
No, I can't. No.
Right.
I can't.
On what? Right. So
on the grounds that I've set out.
Yeah, and we would argue that it's exactly why you should furnish us with the report. But so,
but Deputy, can I just ask for 1 second?
Sorry, here, Mr.
Can I just say for 1 second?
We're time restricted, and you're here to answer questions. So,
but I'm trying to.
You,
but I am answering.
You're refusing to give us the. You've just said no.
But
you've just said no. But even in a confidential manner to.
But is there any willingness here to acknowledge that, you're suggesting I'm not, you're making out that I'm refusing to do it because, we just, but the reason is that we're involved in commercially sensitive negotiations involving significant public funds.
Yes, but you also
are you really suggesting that we need to have this discussion? Is it really suggested, Deputy, with all due respect, that we will publish commercially sensitive information in the middle of disputes that are going to the High Court, disputes that are involved millions of taxpayers' money?
You've refused point blank here today to furnish us confidentially with the report, right? So that's not been made public. You've even refused us to public or to furnish us with it in a confidential manner. But I'm just going back to again what you said about that once you got the report that you have since May, that you yourself said you'd be able to discuss updated costings once the report is completed. And now we have on public record, point blank, no, you're not publishing the report, sensitivities, fair enough. Then we put the proposal to you, would you furnish us with it confidentially? And you've said a point blank, no. Right, that's just for the record. I wanted clarification on that, so you're refusing that. Okay, I want to get on to nursing homes, and I've raised this issue before with the HSE about the exploitation of elderly people in nursing homes by means of charging them for items that they would normally access free of charge if they were living in the community. Items like bed sores, bedsore creams, physiotherapy, occupational therapy, speech and language therapy, painkillers, in fact. And the HSE had advised the committee that they've engaged with your department with regard to this. And I had received an FOI response, and that indicated that the HSE, what it said was that the HSE had said that there is no doubt that this is an issue, but they were limited in what they could do. Now, has the HSE expressed that concern to yourselves?
So I'm aware that there is an issue here, because I'm aware that it was raised previously. There's a public debate about it. I can't recall if the HSE has directly raised it with us. Fiona may be able to. No, we don't think they have, but we can check that.
Okay.
They may have done, but I don't recall it myself.
Okay. The HSE officials had stated that the solution was a provision to be inserted within contracts with nursing homes. Now, they had suggested that, and so you're not aware of any progress had been made in that regard?
I'm not aware of that. That's not to suggest that there hasn't been progress, Deputy. I'm not aware of it. We can check. The
HSE had said they were limited, so they were saying to the department.
You have 2 minutes left, Deputy.
Yeah.
2 minutes.
Okay. Just in relation to that.
They were saying they were limited in relation to the contract. Yeah, we can check that. I'm aware, Deputy, of the issue, but I'm not aware if any progress is made or if they make contact.
Right. Will you get back to me on that, Mr. Watt, please?
We will. Yeah, we'll come back to you.
Just in relation to the dental treatment service scheme, I mean, it's on the verge of collapse right across the state. There are upwards of 80% of medical card holders can't access dental treatment. You have cancer patients, you have kidney transplant patients, you have patients with diabetes, all medical cards. Now, that's a farcical situation when 80% of medical card holders in this state can't access dental treatment, and that has been going on for almost a year now. So, have talks with the Irish Dental Association begun, and what stage are they at?
So there were some discussions about this, and there's been an allocation in the budget which was announced. I think it's 10 million extra for the DSS. Taoiseach
had said that in a response to me, but obviously that's no addition whatsoever because they're leaving in their droves. But my question to you is, given that 80% of the population that hold medical cards can't access dental treatment for at least the past 6 months, what are you doing about it? That 10 million's not cutting it at all because they're leaving in their droves and they're not coming back. So when can people access dental treatment, people with medical cards? When will this issue be resolved? It doesn't seem that you're putting any priority to it at all. I mean, if you were to say about any other country that people entitled to dental treatment under the medical card, 80% of them can't access that treatment.
Time up, Deputy.
For coming up on a year now, I mean, that would be staggering.
Come back in.
Can you tell us when it'll be resolved?
So we are aware, Deputy, of the issue, and I think it relates to the pricing, the pricing that's available for patients under the scheme versus what dentists would charge private patients, and obviously there's an issue there, an incentive issue, and I understand the question. So we have to negotiate now with the Dental Association that will take place next year, so early next year. So we have to discuss with them about starting
negotiations next year. Is that what you said?
So we have had some discussions with them, I understand, and there is an allocation there, and the plan is that we will engage with them and seek to address some of the questions. But there is absolutely a question with the scheme. Absolutely agree with you, and it's about, I think, the level of supports that are provided under the medical card scheme versus those that are medical under the social insurance fund, social insurance scheme, and then what dentists are.
Could I just make Chair, could I just quickly make an observation?
Now, you're going over time.
There, please. Just the very fact that negotiations haven't begun when people the length and breadth of the state are waiting for dental treatment. As I said, cancer patients, kidney transplant patients, all medical card holders, and negotiations haven't even begun. That's incredible. That's disgraceful.
Thank you. Okay, I'll allow people back in for a second round of questions if time allows. The next member is Deputy Nessa Hourigan, and you have 10 minutes, Deputy Hourigan. I'll give you a reminder after 8.
Thanks, Chair. To be honest with you, I'm not sure that there's any point in talking more about the Children's Hospital, but I would like to put it to you, Mr. Watt, that people on this committee are well aware of the complex contract involved, and even a live contract, and that it's a multi-strand process. And I think everyone on the committee, and indeed the public, understands that, you know, there are escalating construction costs at the moment and material costs, and that the contract is subject to claims. But I have to say, it is very unsatisfactory for you to come here today and say the discussion of costs by officials, however hypothetical or otherwise at this time, may prejudice enforcement of the existing contract and very likely negatively impact or jeopardise the Development Board in its ongoing engagement with the main contractor. Like, ultimately, that statement presents itself less as a discussion of the complexity of a contract and more as an attempt to constrain or control or remove the public oversight of this project. I know nobody likes to talk about spiraling costs, but and we've just, in fairness to Deputy Munster, you know, oversight of public spending is a fundamental principle of public life, and it's in fact not your role to act as gatekeeper here. It's completely valid for the Public Accounts Committee to ask these questions, and we should have access to that report.
Thanks, Deputy. So I'm not refusing to answer any questions, and I've appeared in front of the Public Accounts Committee and the Health Committee previously on this for a whole day. Our colleagues have appeared many times to discuss the Children's Hospital. So I don't think it's a fair characterisation to say that we're not willing to answer questions on it. We have repeatedly, time and time again, and very happy to do it today again if you wish. That I'm happy to discuss costs. The different factors which have increased the cost of this hospital are well known. The risks that now relate to the finish out of this contract relate to inflation. And there's a provision within the contract for paying an amount above the prescribed 4.5%, which is in the contract. There is delays in the contract which will, by necessity, push out the cost because it'll have to be managed for a further period. And then there's the issue of claims, and those claims are set out very detailed in a note I sent to you, setting out the detail of the claims, the scale of the claims, some settlement of the claims that have taken place, and so on. So it's our judgment, Deputy, and it's not a clear decision, absolutely, what's the right or wrong decision. But there's a trade-off here between providing information, detailed information on our assessment of what the likely outcome of the settlement of these disputes will be.
That's fair enough, Mr. Watt, but I was actually quoting your words. Your words in your statement today is any discussion of costs by officials, however hypothetical, could negatively impact or jeopardise the ongoing engagement. And that does, does contextualise this discussion as the work of the Public Accounts Committee damaging the process of completion in terms of the Children's Hospital. And I think that that's an unfortunate choice of words.
So I'm not saying that, Deputy. Now you're twisting what I said. What I said is that we are in dispute here with the contractor. Our estimates of the outcome, various scenarios of the outcome, informs our thinking about our negotiating strategy. It's not, and frankly, it's not fair to suggest that public officials should publish information on scenarios pertaining to disputes, contractual disputes, some of which are in the courts. I would,
Mr. Watt, to characterise it though that we want to go through every dispute in detail is not accurate.
Didn't say
what we're asking for, well, that's the impression that I'm getting. That's the inference I'm taking from what you're saying, and maybe it's incorrect. But you're implying somehow that we want huge amounts of details about 600 claims, and of course we don't. We want headline figures.
Yeah, but you've asked for our assessment of what ultimately the resolution of these issues will be. Our best assessment.
Yeah.
That then will impact upon our ability to satisfactorily conclude these discussions.
Okay, if we can stay on capital expenditure and in fact governance, could you outline for me the oversight? Because in your statement today, there's some discussion around the hospital groups being stood down and advisory groups, and obviously we're in the process, hopefully, of moving to regional areas in terms of Sláinte Care. I'm trying to understand what oversight the department has on capital expenditure at the moment, in terms of both capital assets that are existing and in terms of new projects. And the reason, and just to give you a bit of context, the reason I'm asking is because on the health committee this week we dealt with the closure of Owen O'Curra in Middleton. This seems to be a decision that's made entirely by the local HSE in direct contravention with government policy of a vision for change, because it's going to leave East Cork with 0 residential mental health places. And it seems to me that there's almost no oversight from the department. It's some person in a room making a decision, and they seem to be a law unto themselves. There's no comeback. There's no possibility to change it, even though it's in breach of government policy. I'm just wondering, first of all, how is there so little oversight from the department on decisions like that, where a building is allowed to be run down to the state that it's in, and how does that fit into this new model that is being described to us?
Thanks, Stephanie. So, in relation to the regional health areas, the hospital groups, that's related to as you're aware, the proposed reforms in terms of improved integrated care, integration of the CHOs and the hospital groups, and that's the reform plan that's been set out, and we've set out. We're developing now an implementation plan, and as part of the implementation of this, the hospital group boards of the hospital groups are being shut down. So it was decided not to replace them because they were coming. A number of the members were due to leave. We had to replenish the membership, so it was decided to in effect stand down the groups in preparation for the new structures that ourselves and the HSE are working on in terms of delivering a key aspect of Sláinte Care. In relation to oversight of capital. So we agree with the budget. We agree with the budget overall capital budget. Every year, there's within the discussions taking place between our department and DPER. There's a decision on the allocation. There's a view reached as to what capital projects can be delivered as part of that, and that's set out within the National Service Plan and the letter of determination that the minister shares with the HSE, and the HSE then are provided with delegated sanction to deliver projects in line with that mandate. So,
and sorry, just to be clear, what's the process of kind of fact checking that against government policy? So
the deliverable of the capital plan, setting out of the capital envelopes, the agreement on the service plan, that's consistent with government policy. That's the objective, is that it delivers on government policy across all the different areas. So
in the instance I described, where the local area has made a decision to close a facility that's in direct contravention with the vision for change, what recourse has the department got there?
So I'm sure the HSE are closing it for a reason, Deputy. I'm not close to the detail of it, but I'm sure there's a reason, probably around the suitability of the premises now. Is that the issue, that they don't believe the premises are suitable? Is that the problem?
Is that the level of suitability, if applied to most of the mental health residential facilities that we have, would lead to a tsunami of closures across the country. So why they've particularly picked this building to close is a mystery to everybody, including the families who are left behind by this decision. So I'm just wondering, in this case, and I totally understand that you wouldn't have sight of this case particularly yourself or information around it, but where the HSE have made a decision on the removal of services that relate to a capital asset, and it's in breach and it doesn't particularly have very good reasons behind it. What is the recourse of the department on this?
So the HSE will make the decisions. Their HSE estates manage their estates. They have to make a judgment call on any premises, whether it's suitable, whether it still meets their needs, whether they're happy that it complies with the various standards and regulations and so on. So they will make the decision. Can they be directed then not to proceed? I guess in theory they can, because
has that ever happened?
They report to the Minister for Health, but whether I don't know if it has. But of course, it'll be very difficult for the Minister to judge, to second guess the people who are responsible for day-to-day management of the facility, and they are legally responsible for that. So
Mr. Watt, sorry, I accept that point, but I think that is the key problem, is that it's very difficult for any of us to second guess people, and it does look like the HSE is completely unaccountable here.
Thank you. Time up, Deputy.
Thanks, Chair.
Thank you. Yeah, okay.
The next member is Deputy Colin Burke. 10 minutes, Deputy Burke.
Thank you very much, Chair, and thank you to our guests for their presentation here this morning. Can I just ask you what the report in the value for money was published last night at 9 o'clock? Why wasn't it made available to the committee before that period of time? It was only published at 9 o'clock last night. So we're at a disadvantage in that, and that report has been with the department for quite a considerable period of time. I've raised a number of questions on it, and then it's published a few hours before we have our last meeting, public accounts. Why wasn't it made available before this meeting to us?
Thanks for the question. So the value for money report has been in preparation for some time, as you're aware, and basically we had to bring it to government, and we couldn't publish it until we brought it to government, and we had been seeking to get it to government, but we managed to get it to government this week.
One of the figures in that report
on Tuesday of this week.
One of the figures in that report, and I've had a very fast look at it now, one of the figures in that report shows that the average cost per week in a public nursing home is €1,616. And this is 2019 figures now, €1,616, whereas the private nursing homes the cost is €992 per week. So there's a 62% difference.
Yep.
And I know someone else had raised earlier about additional costs being imposed on patients in private nursing homes. But isn't there a huge disparity here in relation to what it's costing to be for care to be provided in a public nursing home compared to a private nursing home? And how is that? How is private nursing homes, there's a criticism of them in relation to the low pay scale in private nursing homes. There's also criticism in relation to additional charges that are being imposed on them. But isn't there also the argument now that if it's costing $1,616 per week in a public nursing home, there's a huge disparity in the level of support that's being given, and there's actually discrimination in real terms occurring now?
Thanks, Deputy. Yeah, there's definitely a disparity in costs. I'm not quite sure whether this accounts discrimination or not. If
families are ending up having to pay additional costs to private nursing homes because they're not getting the required state support under the Fair Deal scheme, that's discrimination.
Okay, but the report suggests, Deputy, if I understand it, that the costs in the private sector are lower than the public sector.
But the costs are lower, but they're now being forced, and this is this is a review carried out in 2019. So these are costs in 2019. Costs have gone up substantially. They're not able to carry the cost, therefore they're imposing them on the patients, which there's a lot of criticism, and it's justified criticism that they're not entitled to do that. But on the other hand, the department has sat on this report for quite a long period of time, and we now need to have a situation to have, when is the review as regards the fair deal, the funding that should be provided to provide the level of care to people in private nursing homes, and to have a fair comparison with public nursing.
Yeah, thanks, Deputy. Like, I agree with what you've said in terms of, you've said the factual position. I'm not entirely sure though what the policy inference though is from it, because as I understand the scheme, we will support that level of cost, whether it's public or private.
But there's been no increase in the support levels for people who are in private nursing homes for the last number of years, whereas the cost of providing that care has gone up.
Yeah, so you're suggesting that the price is too low. You're suggesting that we should pay more for.
No, I'm saying that the private nursing homes are finding that to meet the level of care that's required, the cost of the level of care that's provided, that they're required to provide, they're having difficulty in doing that without imposing the charges, and on charges which they're legally not entitled to make. So what I'm asking now is, we've now got the report published after all the work was done nearly 2 years ago. What action is the department now going to take to deal with this issue?
So the cost differential, as far as we can establish in the report, there's been many reports on this. There's the NTPF pricing review, which looked at these issues in detail, and there's the value for money review. I think Tom Ferris was the primary author of this review, and it just showed very significant differential. Most of the differential seems to be accounted for by staffing, and there's two issues there. There's three. There's the overall pay costs per grade. There's the different mix of staff. So within the public system, there are more nurses and there are fewer healthcare assistants. In the private system, they tend to employ more healthcare assistants relative to nurses. And then there's the overall staff.
But the argument is that they can't afford to employ more nurses because of the level of support that's being provided under fair deal. Anyway, can I move on to? Can I just
finish the point I'm making though, because it's not absolutely clear to us. So the differential, obviously there's a cost differential with those factors, and wage cost is the main, rates of pay, the numbers of people employed, and the staffing mix. But there's also this debate that the level of need, the level of acuity for people in these homes for is different between public and private.
I don't accept that. I don't accept that.
Yeah, but
I don't accept that, because if someone is admitted into a private nursing home and they're quite mobile at the time, and then as years go on, the level of care they require increases, there is no increase in the support that the private nursing home will get. Yeah, that's the reality. Yeah, no, so I don't think that's a fair comparison. Can I move on to the issue?
The point I'm making, Deputy, is that it's argued, and I guess this is what we're trying to establish with the review. Is there any evidence to suggest that the care needs of residents in different settings actually differ? And if they're the same, well then, how then are the costs different? So it's not a question necessarily of us saying that we're not providing enough support for the private. It's saying, well, why is there such a large differential? Because ultimately the state is picking up the tab right across, and just generally in relation to fair deal, like it's 1.4 billion. It's over $1 billion of taxpayers' money. I think there are 24,000 people benefit from the scheme. There's an enormous challenge in terms of the sustainability and how it relates to home care.
But there was an underspend. There was an underspend last year on the scheme from I think it was 998 million as opposed to the budget of 1.1 million or 1.1 billion. Can I move on to the issue on the cyber attack and
you have 2 minutes left, Deputy. 2 minutes.
Just on the cyber attack and the failure to take action on time. Do you believe, and the department were aware that there were risks there, do you think that a lot more could have been done in order to prevent the cyber attack? and evasive action taken at an earlier stage. Now that we've seen the PwC report.
This is the attack on the HSE.
Yes.
The HSE. So I think the report sets out very clearly that we need to invest in improving security, that there's a variety of steps there that the CEO of the HSE is determined to implement, and clearly that's a significant body of work to protect this security.
The warnings were there beforehand. Do you believe that action could have been taken at an earlier stage to prevent it from occurring? Do you believe that action should have been, and that people did highlight that there were concerns?
So clearly the preparedness could have been better, and that's always the reaction when an adverse event hits and which has such an impact. So clearly I think the report says this, and I think the HSE have confirmed it, that their level of preparedness could have been stronger.
Were the issues raised with the department before the cyber attack, and did the department give assistance to make sure that the appropriate action could be taken?
So it's ultimately it's a responsibility of the HSE deputy in terms of their systems and how they manage their systems. I'm not aware.
The question I'm asking is, were there concerns raised with the department at any stage over the last 12 months prior to the cyber attack occurring?
Not that I'm aware, deputy, but I need to check. Like, I presume the people who look after this the IT security people and the HSE and across all public bodies, they meet. I think there's a coordination group, so they're talking all the time about the risks and about the level of preparedness. So I'm sure there's. But
did the department get any advice over the previous 2 years about additional precautions needing to be taken?
Not that I'm aware, deputy, but I can check that for you. Not that I'm aware.
You might come back to us and let us have an answer to that, because I think it's extremely important that where government departments get advice and it's then not followed through on.
Thank you.
But nobody is suggesting that they received advice they didn't follow through on.
But you said you're not sure whether he did. This issue was raised in the previous 2 years.
Yeah, I'll check, but I don't. It's ultimately for the HSE and for the different security people across the system. But I will come back to you.
Thank you.
Thank you.
Thanks very much.
Just in relation to the nursing home scheme, Mr. Watt, in fairness to the deputy and to the committee, that report was started in 2018 and it's due to be published, as I understand it, in March 2019. Now, I don't expect you to go backwards because you were there since about this time last year. But this committee done a report on the Fair Deal scheme, and the recommendations were accepted by your department in full. And that's, as I recall, about 10 or 11 months ago. But accepted in full. And in fairness, the point made by the deputy, and this is a real issue, that it's then published at 9 o'clock last night. Can you understand the frustration of the deputy and the committee at the committee being treated in that way, that we make recommendations, they're accepted in full, 11 months later, we still haven't got it. But hey presto, the night before the meeting, when everybody's gone out of here, the report comes through. And it's not, I'm saying this to you as chair of the committee, to me, it seems like bad practice, and it just, it does seem like the committee being treated a little bit of smart aleckness about the way it's been treated.
Well, Chair, look, I absolutely, totally dispute that accusation. I find that very disappointing. Officials in the department are working incredibly hard, have been on this issue. Of the report that was produced by the CNAG, the report that was produced by the NTPF, the report that was produced by Tom Ferris. There's also the nursing home expert working group on COVID. All of these reports cover more or less the same ground. We have implemented the vast majority of the recommendations on these reports, and I think I've set out a note to you this week, setting out once again our response to the vast majority of these. And there's one issue about a report which absolutely I accept we should have published earlier, But like, I think the committee should acknowledge the significant response to these reports that have been set out. And this issue is a very important issue. The report on value for money really, to Deputy Burke's comments earlier, it sort of sets out what it's more granular detail, but it sort of sets out broadly what we know already in terms of this differential. And we're committed to working further in terms of what that might mean and what that will mean in terms of pricing and any supports. But I don't accept that the officials in the department are working on this are doing many things, and they have responded quite proactively, I think, to the recommendation of these various reports.
You can understand from the committee's point of view, when it arrives the night before, just hours before the start of this meeting, it does. From the committee's point of view, I can see why members would feel, why members would be critical and would be concerned about it. But anyway, just making that point, and I know you've sought the case as to why it is delayed, and thanks for that. Deputy Carty, next speaker.
And good morning to our guests. I just want to return to the National Children's Hospital because it is the most significant capital outlay being undertaken by the state at present. I wonder if Mr. Watt could just confirm when he now expects the hospital to be finished construction and by what date the 9-month service activation period is expected to have elapsed.
So I think, morning Deputy, I think 2024 is when we expect it to be complete.
At any particular time in 2024?
No, Deputy, I don't have a particular month, but that's the time frame now, which is 3 years from now, I think.
So I think the term you used previously when asked in relation to the final costs was that there is no point in speculating. Do you understand how even that phrase would lead to consternation among many, considering that in 2016 we had an estimated cost from your department of 800 million, that increased to 983 million in 2018 and 1.43 billion euro in 2019. And since then, the department have been refusing to speculate, as you've put it, and that has led to fears that the costs will be substantially more. And the figure of 2 billion euro has been set out. Do you recognise that there is a failure on the part of the department to be transparent, but also that means that there is a difficulty in this committee doing our obligations with regard to accountability when we don't have that information and we're not being provided with that information?
So thanks, Deputy. So we set out our assessment of the latest cost estimates, what we think the hospital is going to cost, and we said that there's a risk to that, and we set out what the risks are, I think very clearly on several occasions. So I don't accept that we're not being transparent. The point I've made very clearly is that in terms of this report, that the report contains commercially sensitive information which were to be in the public domain would undermine our ability to deal with these disputes, which involve very significant sums of money. That's the point I was making. I wasn't making any other.
So on that point, what is the final estimated cost as you see it now?
So the final the estimated cost that we've put in the public domain is the figure that I mentioned previously, and I've said that there's a risk associated with that number.
Which is?
So I think it's 1.43 billion is the hospital cost, and then it's 1.7 billion then for the integration piece and the other elements of it.
Okay, so you're saying that those final cost estimates as you have them haven't changed since 2019?
So they're the cost estimates that we have put in the public domain at this stage, and I've said that there is a risk to that cost estimate. Yes, we've said that, I think, now for about the last year. I think we've said that.
So this figure, that 1.7 billion all incorporated, when was that estimate made?
I think that estimate was made, I think it was early this year. I don't recall the exact month, but it was made. Yeah, I think it was early this year. I'll establish that for you now. in a second deputy.
So the report that has been subject to much discussion, that was a report that was, and I think the phrase you used in your letter to us on the 19th of May was that it was an analysis by the NPHDB. Is that how you would describe this report?
So it was an analysis by the project, by the development board, yes, the project board.
And in that letter on the 19th of May, you said it had been submitted to your department for independent analysis and scrutiny. Is that correct?
If that's what I wrote down, yeah.
So who carried out that independent analysis and scrutiny of the analysis by the Paediatric Hospital Board?
So the NDFA, the National Development Finance Agency, were involved with us. So we looked at it, our colleagues in the department looked at it, and the NDFA were involved in that process as well.
So we have a report from the hospital board, and then we have, is it a separate report from your from that process that you're after describing, or is it a track changes type document? What form does that review take?
So I think it was an assessment, a written note or assessment of the costings and the strategy set out. Those documents, and I understand that you are saying that you can't provide us with that report, but you're confident that there is nothing in those documents that would warrant you revising the 1.7 billion figure that you have given us here today? No, I haven't said that. I said there are issues which are highlighted in the document, which are around the project delays, around inflation, and around dispute resolution, which will lead to a potential higher cost. Yeah, that's what we've said, and we've said that repeatedly.
So can I take it from there, that's what you're saying, because we know some of those things are absolutely realisable, particularly inflation, because we're now in an inflationary period, that the 1.7 billion will be higher.
So yeah, so I think we've said that, Deputy, previously. Yeah, that there's a risk to that number, absolutely.
But there's actually a reality that number isn't going to be met.
Oh, I think that's a pretty fair assumption. Yes. Yeah.
Oh, okay, and I have to say, and again, put on the record, I think it is incredibly worrying that there is documentation that isn't being furnished to the Public Accounts Committee, and that we don't even at this late stage have even a guesstimate as to what the final cost of this will be. And on that basis, do you accept that the premise of the contract itself, in which this project has been delivered, was fundamentally flawed?
So do I accept that? Well, there's a serious debate to be had, which we've had before at this committee and the Health Committee on this. So the normal contract we go with is a fixed price contract, and it was decided 2015-16 that type of contract would not have led to any bidders for this project, and that a two-stage process where works were undertaken, and as those works were being done, design would be finalised, and we'd go from a draft stage to a more complete design, and at that stage then we would tender for the project. I think there were mistakes made in the implementation of that, which I think we've set out previously around how that was operationalised. Do I think that the decision to do a two-stage process was fundamentally flawed and wrong? I don't think the decision.
No, I didn't say the process. The contractual basis on which this hospital is based. Do you accept that that is flawed?
The contractual basis of.
So the contract itself that has resulted in a project that's now due to be delivered in 2024, which is beyond the original time scale, and
you have 2 minutes left, Deputy.
Within 2 years of that you are unable to provide any single assurance in terms of the final cost. Do you agree that when you're dealing with a contract on that basis, that's a flawed position that we're all in?
That's the same, Deputy, with all public sector contracts. All public sector contracts have very variable clauses. There's no public building built of any scale where you can say, oh, the school is going to cost 10 million or the road's going to cost 200 million, and you can say when you sign the contract that that's the absolute cost with certainty, because nobody will sign a contract on that basis.
That's not what I'm saying. What I'm saying is we're now in a situation where we're in the middle of construction, and you as Secretary General of the department responsible can't provide a guesstimate as to what the total cost will be. Nobody's asking. We all recognise that there will be issues there. How long do I have left, Chair?
1 minute left, Deputy.
Just to answer that question. Nobody can give you an answer, whether me or anybody else, by the nature of how large-scale construction contracts are operated in Ireland and every other part of the world. There's variability clauses related to inflation, and then there's dispute resolution about the deliverable of the design.
My point isn't that I wasn't looking for a definitive figure. I was looking for an estimate which can't be provided. You know that this committee alongside...
Deputy, sorry, just to clarify again for you, nobody can provide that estimate for you. Nobody can provide an estimate for you. Like you're asking somebody, anybody, whether it's me or anybody else, to basically give you a forecast about what the next 2 years are going to be in terms of construction inflation or the outcome of disputes around hundreds of different matters. So nobody can provide you with that figure.
I find that from a former Secretary General of the Department of Public Expenditure, on the basis of what you're saying, it would be impossible to develop a capital investment program at all if we were to say that every single contract is meaningless in terms of the final sum.
That's not what I said, but there's a reality around building large construction projects.
And we accept. We accept that.
So you accept that I can't answer the question.
Okay, we're dealing with a project in which the original estimate cost was 800 million and which now is above 1.7 billion euro, and you're saying we can't have a final estimate as to what the final cost will be. I would consider that to be a flawed process, and I don't believe there is any other capital project at this late stage that we couldn't have a guess as to what the final cost.
You can have a guess, all right. Of course you can have a guess, but you're asking me to tell you what the final cost will be.
Deputy Cormac Devlin, 10 minutes.
Estimated cost. I think that's a fair question. Unfortunately, we didn't receive a fair answer.
Deputy Cormac Devlin.
Well, I think you've received an answer, Deputy. Now, in fairness, you did receive an answer. You may not like the answer, but you received an answer.
Deputy Cormac Devlin, 10 minutes.
And welcome to our witnesses, and it's good to engage again from our last engagement in July. Staying with the Children's Hospital though, and following up on some of the questions that I had in July, and it's clear obviously that we're not going to get a copy of the report, and to a certain extent I can appreciate why not. You know, when this committee visited the site itself, there was clear there were all sorts of claims. Some that were, you know, in theory they were legitimate claims because the project or the design of the project had actually changed. So I can appreciate from that perspective. But obviously, Mr. Watt, you have to realise from our perspective as the Public Accounts Committee, we too are very interested, as I'm sure you are, and indeed other Secretary Generals are, as to what the final cost is going to be. As I've said before, this is an essential project. We are in, whether we like it or not, we need a brand new state-of-the-art children's hospital. But we would like, as the Public Accounts Committee, to know what, even a guesstimation of what cost. And regardless of what the report says or not, I think it would be helpful to give a ballpark figure to this committee and ultimately to the public to say how much the project may cost, subject to legal fees, etc., and other charges. But staying with that as well, can you give an indication as to what percentage of the project is complete?
Thanks, Deputy. And just to say again that we share the concern, and you know we absolutely agree with you. But there are different views on this. That's just the reality of it. I think those views are legitimate on both sides. Okay, I think we have a legitimate view here, which is not about in any way stifling committee or not supportive of transparency in any way. It's just a different view about the advancement of state's interests. In relation, Deputy, in relation to, sorry, what was the
percentage of the completion of the project? Yes,
so it's between 50 and 60% at this stage in terms of I think the value is a little bit higher than the actual physical, but It's halfway or a little bit over halfway at this stage.
Okay, so assuming from that, and let's call it 1.7 billion, if there's about 40% yet to run, and that includes fit out and costs and everything else, would you agree that it could be in and around the 2.2 billion, or would you even give a figure?
So I just don't think there's any benefit in me speculating at this stage on what it's going to cost. I just don't know.
So you won't even give a guesstimation really as to what you think the final cost may be?
I don't have a basis, Deputy, to give an updated figure from the figure that we gave.
And can I ask then, does the report give an estimation as to what the final cost will be?
The report gives ranges of costs of different issues that are in dispute and different factors.
That I can understand why.
It doesn't, I'm trying to recall exactly, it doesn't come up with a point estimate, no.
Okay. So on the basis that it's about 50 to 60% completed, and as I say, the vast bulk of the construction, the outer skin of the building is complete. That's what the committee saw, and obviously progress has continued from July onwards. Was there built into the contract, or was there any foresight into the fact that with rising inflation costs, were any materials or products pre-purchased at any point during this construction phase to try and bring down the cost, or are they being purchased at the point of need?
I don't know, Deputy, the answer to that question. I don't think that they may hedge forward some of the costs, I guess, for large building contractors if they're buying a lot of steel or whatever materials are involved here. They may hedge forward.
You're not sure.
I guess I don't know.
Not sure to the quantity either, and I can appreciate that would be the board probably would have more detail.
Well, it'd be the contractor, I guess, because the contractor may have a process where they hedge forward.
I imagine they would, but can I also ask you then, in terms of the department's engagement with the National Children's Hospital Board? How often is that engagement? Is that monthly, weekly, bi-weekly?
So colleagues in the relevant section in the department would be dealing with the board, I guess, at least on a weekly basis, Deputy.
On a weekly basis. Okay, and then in terms of, I note from your documentation that you supplied to the committee, which is helpful, you give an estimation of around 2024 for the completion date for this project. Does that include the 2 satellite centres as well?
Yes, I think it does.
And would they be complete? I know one is complete, but would they both be complete by 2024, or even indeed before 2024?
Well, as you mentioned, one of them is complete and was opened this year in Tala, which is a great centre.
Absolutely.
And my understanding is yes, Deputy. But I will. If that's not the case, we will come back and confirm that for you. But I think that is the intention. Yes.
If you could, please, that would be helpful. Just in terms of the analysis that was done by the National Paediatric Hospital Development Board, I note in your email to the committee, you said analysis was not in relation to the progress of the National Paediatric Hospital, but it related to forecasting of critical paths and scenarios for the optimal completion of the project. Now, what exactly do you mean by that? Is that in relation to the completion of the overall project, or is that in relation to the actual construction of the project, or both?
I think it's both, Deputy. So it's what options are available to ensure that we complete this as quickly as possible and with the lowest cost to the taxpayer. So that was a sensible thing that we decided to stand back and review.
And is there anything that stands out to you in that analysis that you'd like to share with the committee that you think could be a big stumbling block for the completion, so it could even extend it beyond 2024?
No, I think the big challenge within the project is to ensure that there's sufficient resources been allocated to the project. That's something that the board and the contractor are continually engaging on, and there's over 1,000 people on the site now, and you probably saw the activity when you were there yourselves. So it's to ensure that the project is resourced and adequately resourced to deliver on the type of time frame. And secondly, then it's to get to a better place in terms of dispute resolution, and at the moment there is a more positive engagement, I would say, in terms of the dispute. So we're trying to engage more positively and expedite claims and get through things faster. So I guess they're the two things that stuck out along, Deputy, obviously, with the complexity of the project. Like this project is, I think, 4 times bigger than the most recent hospital that was built in the state, which is Tala. So this is absolutely enormous site, and when you actually get involved and look at the complexity of it, it is incredibly complex.
And that's something that I said to the hospital board, and I said indeed to your department in July, that I think that needs to be another element of explaining the sheer scale of this plan. And can I just, in the last few moments that I have, can I just turn to the legal costs? I've other questions, but I'm not going to get time on them. Just in terms of the legal costs for the department, what struck me, and it's the MDU refusal, and there's department legal costs of in excess of, I think it's 1.6 million euro, which is extraordinary. And then there's another, and is that the Medical Defence Union? Is that what that is? And then, because that case is rumbling on quite some time, but what's even going on longer, and what is quite frightening from my perspective, is that the thalidomide legal costs for the department. You might just, is that the case that's going on since 2010? I'm just conscious that there's only a handful of survivors left of this case, and how come the cost, they're the second largest legal cost to the department that you stated in the 2020 accounts. Can you just clarify both of those items, please?
Yeah, I'll just get the situation in relation to thalidomide now in a moment, but the MDU is the Medical Defence Union. So as you recall, Deputy, as the market for indemnity, particularly for maternity services, collapsed, the state stepped in and provided the indemnity scheme, the clinical indemnity scheme, which in effect is managed by the state claims agency. So that cover is provided. So there was cover provided by the Medical Defence Union in advance of that scheme, and there were various legacy cases that still had to be addressed. Now, because the income to the Medical Defence Union fell away as the practitioners moved to the state claims scheme, they didn't have the future income then to deal with the liabilities that they'd incurred or were accruing on foot of cases that predated the establishment of the scheme.
And so that explains the elevated cost then?
Yeah, so the state is in effect working through those final liabilities, and we have to take legal advice, because they're obviously it's a question of settling cases and they're quite dated. They go back to 2000.
I'm sorry, just in the last few remaining minutes there, can I just ask you there, just to clarify both figures, both for the MDU and the thalidomide, and just outline why the thalidomide is the second largest legal cost of the department at this point, given the case is running on 11 years or more?
Yeah, I'll come back to you on that, Deputy. There are cases involved. As you say, there aren't many survivors. No. There are 29 survivers from thalidomide. 29, I think, is the number, and there are ongoing issues in relation to some cases. So let us send you over the note, Deputy.
And can you sorry, Chair, can you just clarify both figures for me, please, Mr. Watt, what they were in the accounts for 2020, please, for both MDU and the thalidomide?
Actual legal costs
for the department's legal cost, yeah.
So the legal costs would come in the form of overall costs of the legal team within the department. No,
just for those two headings, please, because I think they're broken down, but I just don't have them to hand. Sorry.
Oh yeah. Yeah, so it's the thalidomide is the MDU is the highest, and that's 1.6 million. So the thalidomide is 117,000.
Yeah. Thank you.
Well, that makes more sense, yeah, because it's
Thank you, Deputy Carol McNeil.
Thanks.
Thank you, Chair, and thank you, Mr. Watt, for coming today. First of all, just can I go back quickly? We had the HSE here recently in relation to the procurement for the original PPE that had to be sourced. Can I just look, though, at the relationship between the department and the HSE and the supervision, or what role the department had in supervising the procurement, if any, at that stage? Obviously, it was a difficult time and everything else, but I'd just like to get an opportunity with you to hear from you about that.
Yeah, so I don't know.
You weren't there.
I wasn't there, so I was on the other side in deeper, and I do recall, Deputy, from my perspective over there, the engagement with Paul Reid and the Department of Health on the procurement. Obviously, it was something that was done very quickly in difficult circumstances where we were trying to access PPE, which was in short supply, and obviously we needed to get it quickly to protect people. So the procurement of that was a challenge. From my perspective, and deeper, it was really to try and ensure that we had proper sanctions and proper reporting, and that we were, where possible, complying. But I can't say exactly what the role my predecessor Jim Breslin played vis-a-vis the HSE, but I imagine that Jim and the finance team were involved with the HSE because the sums were so enormous and working through exactly how we'd go about that. Obviously the HSE were taking the lead, but the department would have been supportive of what they were doing.
Yeah, okay, thanks very much. And just at the moment, obviously there's a significant concern about the third dose booster rollout and so on. I'm hearing from pharmacists just some confusion with the HSE today in relation to having ordered stocks and who they can give it to in that. From a departmental oversight perspective, how are you linking in with the efficiency with which that's being done, supervision of any wastage, the overall cost? Clearly the priority is to get the vaccinations to people as quickly as possible, but is this a sort of an ongoing management issue for you, an ongoing matter for supervision?
Yeah, pretty much, Deputy. Yeah, it's probably occupies most of our time. The last week, I'd say, and the weekend, myself and members of the management team in the department spent most of our time on the booster campaign in terms of looking at accelerating, whether moving, what implications would it mean for the health system if people were to move out into the vaccination centres, accessing staff from other parts of the public service, colleagues engaging with the GPs and the pharmacies in terms of what more could be done, how can we galvanise more, how can we get supplies, issues around the 15-minute waiver, which the CMO acted on yesterday with NIC. So yeah, a whole variety of issues the department is embedded. There's a group that meets every Monday at 2:00. For myself and Paul Reid and the Minister and other colleagues are involved in this pretty much because it's obviously, given the concerns now about the new variant, it's a key part of our response and our protection. Is to ensure that we get as many boosters out there as possible. Okay.
Well, then just in the interest of that, just by way of a bit of feedback, pharmacists are telling me this morning that yesterday they were contacted by a new relationship manager in the HSE to do precisely that, to get that out. And then on foot of that, they were given advice that they would be able to vaccinate people over 18. And then, so ordered a lot more vaccinations. I'm thinking of one in Blackrock where it ordered an additional 800, obviously at cost. And then told later in the afternoon that no, it's restricted to over 50s. So I'm sure it's just a management issue. I'm sure it can be, ironed out, but all of those things add up in terms of urgency, but also cost. So it's really just a piece of feedback more than anything else while I'm here with you. A couple of weeks ago, again, we had the NTMA in with us, and obviously part of that, the State Claims Agency. And one of the things that we're following up as potentially as a committee, and I think the CNAG is around, and you mentioned it earlier, the clinical indemnity scheme. What is the relationship then between the Department of Health and the State Claims Agency on payments by the State Claims Agency? And obviously a lot of this is rooted in health and is rooted in incident management, supervision and so on. Can you talk us through that?
So yeah, so the biggest element of the State Claims Agency relates to medical negligence, and a small subset again accounts for the most significant costs. So we engage clearly when there's a case. Well, the State Claims Agency manage the day-to-day case, so they will decide the strategy and they will recommend. But when it comes to feedback, then in terms of what can we do to reduce the incidents, to reduce the case of negligence and harm. So it's about patient safety, it's about incident management, it's about different ways that we respond. So we set up, there's a patient safety office been established. We've new protocols in relation to incidents. We've a new approach in terms of how we engage with people who suffered from an incident that has taken place. So the department's role really is to get feedback from the State's Claims Agency in terms of their understanding of what's going on, and then look at the policy response and look at can we do things differently? Can we do things to reduce the number of claims and manage the claims process in a more efficient way? Because the amount of claims is unsustainable with the state. The amount of money that we're paying out is absolutely incredible, and it's gone up. It must have gone up over 100% the last 10 years. So it's incredible. So
I think, Mr. Watt, I think people would very much like if there were fewer injuries and fewer incidents.
Absolutely, yeah.
I suppose, rather than managing the efficiency of the claims process, which is of course important from the perspective of the state. I suppose my question is more, what is the department doing to target those areas where we're seeing repeated injuries, which are obviously very, very injurious to the person for their life, but also very expensive for the state. At what stage, do you have ongoing conversations with hospitals? Do you have with the various groups? That's really what I'm interested in.
Yeah, we have. That's why we've established the patient safety office. So that is looking at, I guess, clinical practice, clinical improvements, protocols that can be put in place. But I think absolutely that's where we need to get better to reduce those events that are causing harm to people.
Yeah, that patient safety office, for example, is it watching trends in hospitals? Is it watching trends with doctors? Is it watching trends with procedures?
Yeah, it's doing all those things. So it's looking at clinical practice and clinical intervention, working with our colleagues in the HSE to see what issues are giving rise to these incidents which are leading to harm to people, and what policies. And while I'm not an expert in this area, it comes down, I understand, to clinical governance and clinical management and protocols and practices and so on at an intervention level, at an acute level. And that's where a lot of work has gone in, and a lot of further work. And that's need to be the absolute focus to ensure that we do everything we can to reduce the number of those events.
And what is the process when the State Claims Agency, when a claim is made to them in terms of notifying the department? And are you always notified, or are there cases where the State Claims Agency deals with the matter itself without any notification to you? Is that? Yeah, no,
I think the department, we're notified, Deputy, of the claims, and we're given trends in claims. So we see the broad information about the numbers of claims, the type of claims, and so on. But we're not involved in the day-to-day management of it. That's what the State Claims Agency.
You have 2 minutes left, Deputy.
Right. Can I just ask you just about the, just about Sláintecare? I'm not sure if my colleagues have had the opportunity to touch on it yet. Can you just give me a sense of what stage of implementation are we at, please? Just a quick update.
Yeah. So there's progress made on a number of different aspects. Obviously, enhancing the capacity of the public system. A significant increase in staff this year and last year. The 2 years with the highest increase in staff in the public health system were this year and last year.
What is that increase exactly?
So it's about 5,500 for this year and over 6,000 last year, and there'll be a further increase next year. So that the largest increases ever in the health system. So
we're talking about 12,000 extra, close to 12,000 extra over the last 2 years.
12,000 last 2 years. 800 increase in acute beds. So a very significant increase in acute capacity. The largest increase
dispersed across the country. That's dispersed generally across the 800.
Yeah, 800 additional beds. Very significant improvement in terms of the community health networks, establishment of the community health networks. I think we're due to establish 96 of them. I think we've got up to 35, 40. Primary care centres, 40 primary care centres built since 2018. Very significant recruitment into the community side. So I guess in terms of
40 new primary care centres.
Yeah, I think it's 38, 39, almost 40 since 2018 have been built. So very significant improvement in capacity of the system to treat people closer to home and in the community. Increase in home hours. We touched upon this earlier. Home health supports budgets increased by 150 million compared to last year. Very significant increase in home support. So in all the different aspects, increasing capacity, improving care to people near the community, all those different elements, and we've touched on earlier about the regional health areas which we're working on and other aspects of it. So like there's significant progress. We had yesterday, we had the Sláintecare, the new Sláintecare board, implementation board, the new structure we're setting up, where we looked at plans in relation to waiting lists, regional health authorities, enhanced community care, and the Sláintecare integration fund. So we looked at four of the largest projects at our meeting yesterday.
Thank you. We've been over time, Deputy.
Thank you.
Okay, so we'll break for 10 minutes and suspend the meeting, and we'll resume at 11:10. So the next speaker listed is Deputy Verona Murphy. I see you there, Verona. So 10 minutes. No, just say we have seven members to get in, so just ask people to be, and the witness as well, just to keep the questions concise and the answers concise, and we'll try and work through them. So, then all right, Verona?
Thank you, Chair. 10 minutes, is it?
Yeah, 10 minutes.
Thank you. And good morning, everybody, and thanks for your attendance. So Mr. Watt, just to ask you, in previous comments you've said, about commercially sensitive information, but at what point do you think that the public should be made aware of the level of cost for the National Children's Hospital? You're on mute, Mr. Watt.
Moment.
Thanks, Deputy. I guess when we have more certainty and we have further advanced, I think we could provide an update.
But any idea when that might be?
Not at this stage. No, I don't have a sense of when that will be. Hopefully, we get to another milestone. The contract might be able to provide a better update on a firmer estimate.
What would you consider a milestone?
The building, the topping out of the building took place this year. So that's a very significant event. So I think when we get further advanced in terms of the completion of the building, maybe up to 75% completion, or when we're at the stage where some of these issues that were in dispute can we get to finality on those? So as things progress, but I don't have a specific milestone or date in mind.
Okay. So, in your considered opinion, do you believe that this project to this point is value for money?
So I think that the project is clearly going to cost more than we had planned, more than was planned. The service, the building, and all the integration of services for paediatric care and all the other elements that comprise part of that will provide enormous benefits to children in Ireland for generations to come.
And so, and other hospitals, Mr. Watt, but would you consider that the National Children's Hospital is value for money?
Yeah, so I think that depends on your assessment of the benefits to the costs. I guess the other way of putting the question is, could we have built a similar or comparable hospital for a lower cost, a hospital that would provide the same level of footprint, the same benefits, and so on, for a lower cost? Of course, that's a counterfactual that people can debate.
Well, we can't debate it because unfortunately you're the only one with the information, and for the third time in less than 6 months today you've categorically said that you won't be providing the information to this committee.
I don't have any information on what the counterfactual cost would be of building a different hospital in a different location or a different spec, so I don't have that information.
You have possession of the report and the review of which you haven't shared with the committee, so we are at a disadvantage. I noticed earlier you said... But
the provision of that report is not going to help you answer the question, Deputy, you posed about whether this could have been done differently or whether we should have built this hospital in a different location or a different spec.
Sorry, Mr. Watt, the question I posed was, in your considered opinion, was this value for money, this project? Because I don't know that we have anything to benchmark it off, in that we have no knowledge. We have an estimate that you say is not going to be the final estimate. You can't give us the final estimate. But not to get into all that, because you've already said that that's where it stands. I just want to ask you again, the commercial sensitivity is something that worries me. And I'll have to be straight up. It seems to be a bit of a smokescreen. I mean, we have the Minister McGrath, who stands up in the Dáil and says that the vast majority of contractors, and I'm quoting from what he said, the vast majority of contractors' claims have been deemed overinflated. So can you tell me how many, if we're going to robustly defend this, as the Minister says, how many of these overinflated claims are currently at the High Court stage?
I don't know how many are at the High Court stage. There are a number of claims which have been made which are challenged. And I think the Minister set out there's a lot of low-level claims which amount to a low level. I think the 4 million claims have been decided.
Are there any in the High Court?
There are issues that have gone that far. Yes.
So they're not commercially sensitive then, if they're in the public realm already.
Specific cases which are in the courts, of course, are public. Obviously, yeah.
And can you furnish those to the committee? The current cases that are in the courts, the current disputes that are in the courts. Can you furnish that to the committee?
Yeah, well, they're public knowledge, Deputy Soldier.
I understand that, but I'm still asking you to furnish them.
Yeah, we'll establish. There were court cases. Whether there are any court cases still ongoing, I'm not sure.
And just in relation to commercial sensitivity, could you just, as you know, we're under time pressure, but what, like for me, and I might as well tell you, I've been in business for over 30 years, but when it comes to the commercial sensitivity of business contracts, it's between two entities who are involving their own monies and business economic strategy, so it's commercially sensitive. But when it comes to the public purse, where's the commercial sensitivity that is actually protecting the public that you speak of?
So if I'm going into a negotiation on any matter, or you are, and you have some sense of what you're willing to settle on and what you think is a reasonable settlement or a prospective settlement, I think it's fair to say if the other party, Deputy, has some idea about what that is, well, that might impact upon your strategy, their strategy, and where the final outcome will be.
Right.
Like when you were negotiating contracts as a business person, did you tell the other party before the negotiations what your bottom line was?
Well, I think the reality is that the bottom line was when you have two businesses who are in competition, I understand the commercial sensitivity aspect. I don't understand it when it comes to spending the taxpayers' money in the regard of which you express it. Because I think
the Irish taxpayer the Irish taxpayer doesn't expect us to act in a commercially savvy way.
Oh no, I appreciate that they do. What I'm saying is I don't believe that you are, by keeping the information to yourself and not sharing it with the committee.
And do you think we publishing the information now?
You're not publishing it. You're sharing it with the confidential committee, and you've refused to do it.
And what would happen if that information wasn't kept confidential?
I resent the aspersion from you that I, as a member of this committee, might reveal a confidential report.
Please.
And I think you have some neck to come in here and make that allegation.
I didn't say that.
Deputy Murphy.
Sorry.
You've asked me to publish the report.
I asked you a question. You've refused to send the report to this committee on the basis that we're not capable as elected representatives of keeping it confidential. Isn't that what you're saying?
No, I've said on the basis that the assumption is that this report will be published. That's what I've been told.
What do you mean? Who made the assumption?
Well, everything that's sent to all committees are published.
You have 2 minutes left, Deputy. 2 minutes.
So if we gave an undertaking that we would keep it confidential and within the committee, are you saying you'd furnish it?
I think I said earlier that if I was instructed to send the report...
That's a binary question, Jen. Yes or no?
If I was instructed to do it, I'd have to do it.
Who'd instruct you? Who do we need to ask? Is it which minister do you want us to ask?
So as I said earlier in relation to the earlier questions, if people ultimately believe that the state's interests are served...
Sorry, I'm asking the question about the report here. You've refused to furnish it. Now you're saying that if you're instructed to furnish it, you will do so. So who you want us as a committee to ask the minister to instruct you? Is that it?
Yeah, well, I'd have to.
Is that a yes or no?
Yeah, I've set out my position. I don't really know what more you want me to say. I just don't think that this is in the state's interests, okay?
I didn't ask you that. We can decide if it's in the state's interest. If as a committee we give a commitment to keep the report, if furnished, confidential, do you have a difficulty supplying the report? Because you have cast an aspersion that it would be published.
I haven't cast any aspersion on anybody. You said
who would take accountability if it was leaked.
I said who would take accountability for the fact that we've published information which can undermine our ability to get the best value for the state.
Well, I'm going to ask the chair before my time is up and the CMAG, is it possible as a committee to receive this report on a confidential basis for our information and not to publish that, Chair?
The committee as a whole, Deputy, can take a view of that, and we can discuss that in the afternoon.
Well, is it fair then, Chair, to say that the SecGen doesn't have the final determination on whether or not we should receive the report?
I certainly would like to see it, but the committee need to take a view on that, and I'll put that to the committee in the afternoon. Thank you. Your time is up.
Thank you.
Deputy Alan Dillon. Deputy Dillon now may not be back.
Stand in the chamber, Chair.
In the chamber. Deputy Paul McAuliffe, Sean Sherlock is Osloher as well. So Deputy Catherine Murphy.
Thank you. And I think at the outset, I think it's very clear that we're going to have to ask the Department of Health to come back in, because most of our deliberations today are around the National Children's Hospital, as opposed to some of the other issues. And there's very many other issues in the Department of Health that do require scrutiny. I too want to start with the National Children's Hospital. And I was at the committee in January 2017 when the National Paediatric Hospital Board were in, and the figures were discussed. The amount had gone from 983 million to 1.433 billion for the building of the project, and then to 1.7 when the fit out is taken into account. And on that day we got a one-page. We looked for it, and it was dragged out of the people who were there. That's my memory of it. A breakdown of how the costs changed between 2017 and 2018, and we got that one page. But reading from the report that was given to us that day, from the National Paediatric Hospital Board, there's two paragraphs I want to particularly read. One is in February 2017, a figure of 983 million. The project was tendered on a two-stage basis. The bill of quantities for the first stage was based on a partially developed design. The second stage included involvement of contractors with designers in finalising the design and confirming the actual quantity of materials. This included a targeted schedule of 66 million value for money savings. The next paragraph I want to read is, in November 2018, a figure of 1.433 billion is the cost to completion in 2022. Based on a completed and fully developed design, all risks on quantities, programme, omissions, coordination and ground conditions are now transferred to the contractor. We now know, that's the end of that quote, we now know the hospital will not be delivered for a further 2 years. So there are building costs for a further 2 years. Are they on top of what was included in that 1.43 billion? Can I ask you if, there was, I think building inflation was very low going into 2018. We're now in a very serious position in relation to building inflation. That will add to the costs of this hospital. Over 4.5 billion inflation is built into the contract. Was there any penalty clauses built in because contracts have two sides to it? The side of the contractor was the obligation to build it, which they didn't by 2022. Part of that was there weren't sufficient builders on site or oversight. SecGen, the 2022 is the date for that figure. Do you accept that? The 1.43 building cost was for a hospital that was delivered by 2022. If it's not being delivered until 2024, do you accept that there is additional? It's going to cost more by virtue of the fact it's going to take 2 years longer. But is there the prospect of a counterclaim with the and is that active being looked at with the contractor who had an obligation to deliver it by 2022? That's what they signed up for.
Thanks, Deputy. So I think there can be a counterclaim if there's a breach of the contract, but I'm not involved in the day-to-day details of the contract. So I think these questions are probably best placed to be answered by the boards, the Children's Board, the Hospital Board. But you have to demonstrate that there's been a breach and that the delay is due to contractual failure, I guess, as opposed to external factors. So I presume the contractor will argue that external factors have impacted upon their ability to deliver them.
Should we know that when there was lockdown last year, there was months when the hospital didn't recommence work. There was no work on it. We know that there were inadequate number of staff on the site and it caused delays initially. Is that not the obligation of the contractor? Because the more we go into this, the more building inflation is going to be an issue. And it's part of the reason why the Public Accounts Committee and indeed the Health Committee want to keep a close watch on this, to keep costs down, not to put it out into the public arena to drive costs up. I mean, that's where we're coming from. And I don't feel that is accepted.
So everybody involved in the contract from the state side is doing everything they can to keep the costs down and deliver it quickly. That's what they're doing. That's what everybody is trying to do.
Yeah, can I just say to you that I believe there's a real possibility of a counterclaim here for non-delivery within the time frame, and I think that a slippage of 2 years is really serious. The previous SecGen in the Department of Health made a commitment to provide this document when I think it was due the end of last year. He made a commitment to give the committee this document. Mr. Watt, you subsequently came into the department and suddenly the attitude changed in relation to giving the committee and the Committee on Health a copy of this document. Was the change of GenSec material in that change happening? And who are you talking to? Who is advising you in relation to what should happen in relation to this? Or are you the final arbiter?
So I don't know what the previous SecGen's intention was, and I don't even know.
Well, he told us. He told the committee that we were expecting it, and the Health Committee were expecting it. In fact, we delayed our committee meeting into January because we were waiting for this document that we got a commitment we were going to get. So were you material in making a change there in terms of, and who are you talking to in terms of who will make the final decision whether or not to give the committee this document?
The colleagues in the department and in the board responsible for delivering would advise me on this. So we would have a discussion about it, and ultimately.
Well, can we have
2 minutes left, Deputy? 2 minutes.
Can we have the names of the people who are involved in that decision? And maybe you could provide that to us. If you can't provide it now, will you provide it to us later on? Sure. Mr. Watt, you could hardly. I mean, there were problems with this from the outset. You've accepted today that mistakes were made in the implementation. You might tell us what those mistakes were in terms of how you see it. But you can hardly expect us to feel confident in the very people who, made mistakes in terms of how this contract was progressed. It's part of the reason why we want to see for ourselves and adjudicate for ourselves. What were the mistakes that you said were made?
So I think I set them out earlier on, Deputy, and had done that before in my previous role. So I think there are issues with the final design. A decision was taken to move to make a decision on this when it was understood there was a final design, when in actual fact the design wasn't final. And there are many of the specs that we know weren't correct, and that's led to significant cost escalation. So I think I think the mistakes were made. I think the two-stage process was the right approach to adopt, but I think there were errors made in terms of how that was implemented, and particularly in relation to making a decision which it was understood was on the basis of a final design, and it's the case that design was not complete at that stage.
And the costs, do you accept that those costs were to 2022? It's going to go to 2024. We're going into building inflation. That you can't accept that if the state is going to carry the cost for the extension of the time it's going to take to deliver this.
So the state doesn't carry all the cost. So it's in the interest of the contractor to finish this contract as quickly as possible, I would have thought at this stage.
Well, obviously not.
So if the project goes on further, as I've said in response to earlier questions, the extension of the contract will lead to higher costs and inflation, which is above the reference rate that's agreed with the contractor, that will lead to higher costs.
Is it in the interest of the contractor to delay the delivery of the hospital if the state is going to carry the cost for the extension of the time it's going to take to deliver this?
So the state doesn't carry all the cost. So it's in the interest of the contractor to finish this contract as quickly as possible, I would have thought at this stage.
Well, obviously not, because you know the thing, they didn't have enough people on site. They didn't go back after for months after the lockdown. There's no real evidence that that's the case.
Yeah, like I'm not in a position to comment on the commercial decisions they're making, but it wouldn't seem, given the nature of the contract, that it's in their interest to delay this, because the additional costs relate to the costs of higher materials inflation and other aspects, which is a higher cost they have to bear, which we then fund, and there's a cost in terms of the delay for us in keeping the project off us. So I don't think so, Deputy, but I don't know the commercial issues they face, but I don't think they have it. I don't think their incentive is to keep this going.
Thank you, Deputy James O'Connor. Deputy James O'Connor, 10 minutes. Deputy James O'Connor.
Apologies, Chairperson. Thank you very much. Thank you. Yep. Can I be heard at the moment?
Yep, we can. Yeah, go ahead. Yep. Proceed.
Very much just confirming within the complex of Leinster House at the moment. Look, Secretary General, it's important to have you in the committee, and I just, at the outset of my contribution, I want to acknowledge the enormous work that's been done by many of our healthcare professionals right around the country that are under the remit of the work that you do in your department, and what needs to be acknowledged. Obviously, look, there are a number of important issues that have been brought up in many different areas which you hear, but the particular area I want to focus on with you is obviously your department is one of the biggest budgets and biggest budgetary allocations of any department in the state. And one concern that I have, and I think it's important that we would look at it into the year ahead, is around staffing within the organisation, and particularly in the context of frontline medical professionals. In terms of attracting in and in value for public money, which is important, do you feel at the moment that our salaries within the HSE system for doctors, for nurses, for consultants in general, is that something that you are satisfied with at the moment? And do you think that needs a degree of analysis of where we're currently standing in that particular area in order to prevent the exodus of skilled working professionals who are going to places like Canada, to places like Australia, which is common for many people of my age group, and that is something that I want to ask you from the outset.
Thanks, Deputy, for that. The health system, there are now 131,000 full-time equivalents in the health system. That's up about 10,000 since the beginning of 2020. So it's very significant recruitment taking place, net increases in staff. Now within that, there are people who have left for a variety of reasons. And they may be for the reasons you mentioned, that they're leaving to work in other places for better opportunities, better employment, or better salary. But overall, the system is able to recruit more staff and to provide better services consistently. Of course, there are gaps, and we would like to have done more recruitment this year than we were able to do. There are gaps in many different areas. I'm sure you're familiar with the areas where there are gaps, and there's a shortage of staff. The question of salary can be an issue depending on the area, depending on the sector. But I think there are other issues involved as well around working conditions, about the physical environment, about hours people are expected to work, and so on. I think there's a variety of different things. In terms of pay, it's constantly kept under review, and it's something that is reviewed ongoing as part of the overall pay agreement. So it's something that, as obviously the HSE is a big employer, is always looking at trends in workforce and the number of applicants for jobs and the ability to attract people. And I think it's something which is an ongoing concern, and certainly the future, as we try to recruit more people, we need to train our own people and provide more opportunities. We are providing more opportunities for people to go into medicine and into nursing and all the different areas, and the number of places that are available. College places are available has increased again for this September, and there's plans to increase it further. So I think there's a wide issue. Salary can be an issue, and that's something that we keep a close eye on. That's part of ongoing review.
Thank you very much. Look, I think it's something that we need to explore further. There has to be proper analysis done on why young graduates so often feel the need to leave the country. You know, we are seeing in places, particularly Canada and Australia, the opportunities that are being presented to young graduates that have studied, that the state has gone through the cost, the enormous cost of supporting their education and higher education, and there's no disputing that. But it is something that I feel we need to look at. You know, the overall strength of the public healthcare system in this country is something that you know, for the level of investment, for the billions upon billions of capital that is going into this area, is something that I question, and I think many public representatives do, and indeed the public. So I would like to see your department undertaking a body of work to have quite frankly, a very deep-rooted analysis of why this is happening, getting into the universities, talking to people who are nearing the completion of their higher education before they go into working in our hospitals, in the healthcare system as well. And that's something that I feel there's a necessity to do. Look, overall, we have seen throughout the pandemic that there's been so much strain put on the system in general, and I think in terms of increasing intensive care unit capacity as well, which has been done from 200 to 300 beds. If we want to further increase that again to give us scope to prevent us to go back in to lockdown situations and scenarios with new challenges that may arise with the pandemic, there is an enormous level of urgency needed in this area. Is that something that the department could look at? Yeah.
No, I agree with you, Deputy, and I think there's a lot of places in the health system which are very challenging. They're very challenging roles. For people you mentioned, ICU, where the government has increased the number of beds and has plans to increase them further next year, which is really critical and important, and a big challenge is to get ICU staff, the trained staff, particularly nursing staff, I understand, where there's a short supply around the world. And I think there's lots of different elements here. There's about salary, there's about training, there's about working conditions, and there's also, there's an element that people will, for a period, want to go and live in Canada and Australia and other places. That's part of what a lot of people want to do when they graduate. And that's I guess the reality of it. But I think the key thing for us is to ensure that we're attractive, that people do come back. And I think the majority of people who do go away for a few years do come back and then find employment in the health system. But there's an ongoing challenge, I think, to make the jobs attractive. And I think pay is one aspect of it, but it's really about the opportunity to learn and the physical environment in which people work, general atmosphere. Like if people are working in an environment where they're under strain all the time, and that's been the situation, I guess, for large parts of the health system for the last 2 years. That's a very difficult environment for people to have to face and we all hear the stories of the enormous effort that people have put in, and will have to put in even more the next few months to deal with the challenges that will probably coming down the track. So I think in terms of what we can do as a department, Deputy, I'll certainly take that back and reflect upon it. What are the reasons?
I just have to interrupt and apologise. I'm running against the clock. Just a question I want to ask you: are you in any position just to inform us in terms of the looking at the healthcare sector in Ireland, particularly in the area of nursing? This is something that repeatedly has been brought up to me by many people who are working in nursing in Ireland, is that in this, I suppose you'd expect that perhaps towards 2/3 into their career, many of them are actually actively considering quitting it as a career. Do you feel that this is an area that the Department of Health needs to put any degree of effort into reviewing around working hours, around, you did acknowledge there in terms of conditions, and obviously the cost that has to the state? We're losing these highly skilled workers that have a role to play. Many of them, came back into play when it came to the pandemic to I suppose, give their country that service, which is greatly appreciated. But the point has to be made, is that something in the next, medium term to short term future, is that an issue that's going to be analysed by the department?
Yeah, so I'm not going to give a definitive commitment, Deputy, because I'm not sure our work programme at the moment. We have a lot on. I'm aware that the Chief Nursing Officer has engagement, ongoing engagement with the NMO, the representative bodies, and works with the different elements about this whole question of working hours and conditions and so on. I think it's a real challenge, and it's a real challenge for people over the last 2 years in particular. But no, look, I hear what you're saying, and I don't disagree with it, and I'll take it back and see if there's any further work, or there might have been work that we have done which I'm not familiar with, which looks at it in more detail, so we can do that.
Okay, I think that you should be in a position to give me a commitment on that the next time you're before us, and I think I'd like to ask you to go away and look at that particular issue. Just one other point of concern to me, obviously we've all seen what has happened with the Children's Hospital. It has been extraordinarily disappointing and frustrating. It's definitely been a turning point for many in relation to overruns in state projects and putting in the safeguards that are necessary. Obviously in my own region, outside of my constituency, but well within the catchment area of services that have been provided, we are looking at the potential for a new elective hospital to be built in Cork. I want to ask you from the outset, what safeguards are you putting in place now when it comes to the construction of a new hospital build, so we don't have a repeat in Cork what happened in Dublin in relation to the National Children's Hospital?
Thanks, Deputy. So there are plans in relation to 3 elective hospitals in Cork, Dublin and Galway, which would have the capacity to do, I think, between 900 and 1 million procedures in a given year, which will take enormous pressure off the existing acute system and provide a much better care. Minister Michael McGrath and DEPR have put in place new procedures now for capital projects, with reviews at different gates, at different stages in the procurement and the approval process are going through. So the new elective hospitals will be part of that, and so on. Obviously, the big issue about the actual procurement model, the 2-stage approach was used for the Children's Hospital. I don't think they'll be used for the electives. I think it'll be different. In many ways, they're not as complex. They're significant footprint, particularly the one proposed for Dublin. They're significant footprint, but they're not as complex, I don't think, as the Children's Hospital. But there's a new approach to try avoid obviously the unsatisfactory situation that developed with the Children's Hospital and the cost. So.
But in terms of procurement, right, and you have a lot of experience in public expenditure in this area, I am interested in getting a bit of insight from you on it. It's all well and good to talk about the initial contract being awarded, but in terms of the contracts themselves, what safeguards are going to be placed within them to basically analyse a year into a project in a multi-annual or a multi-year build, which a lot of these mega projects are. To go through them and to look at them in detail and to say there is very clearly some serious issues here arising, and trying to come up with some type of a resolution process with the contractor or the contractors that will be appointed in terms of building projects.
Because we're going over time. Just Mr. Watt, if you want to come back in briefly there.
Yeah, no, there are resolution mechanisms within the contracts. So the public works contract, which does have a whole variety, like it's an incredibly complex contract. It has hundreds of conditions, and it has for any given contract milestones that have to be met, and then particular mechanisms for how disputes will be resolved, because there's inevitable that disputes will arise.
Deputy Alan Dillon, I don't think he has joined us yet.
I'm here, Chair.
Yeah, Deputy, yes. Proceed, 10 minutes.
Yeah, thanks very much, Cahill, and I'd like to welcome Mr. Watt and his team, and acknowledge the work in a challenging year to date, and it is very much appreciated. I'll start, Mr. Watt, in relation to Sláinte Care. When does the department envisage that Sláinte Care will be fully implemented?
So I don't know, Deputy, the Sláinte Care, there are many aspects to Sláinte Care, from
an overall timeline.
Yeah, I don't know. I don't know. I think we made significant progress, and we hope over the next 2 or 3 years to make greater progress.
I'm sure you have a project, you have a charter, or you have some sort of end goal.
But there's an implementation plan for the measures that are in place. But the Sláinte Care, in terms of enhancing capacity, improving community care, digital projects, universal health care, free at the point of use. There's so many different aspects to it that we're always going to be delivering Sláinte Care in terms of, it might be called something else, but we make progress on lots of it, and then so I don't think it's not like a project where we're saying we're going to build the road and then it's finished. I think there's so many different aspects to it, but I think the key thing is that significant progress has been made, and there are plans particularly for next year because of the funding that's available. Like the Minister Donnelly and Minister McGrath announced very significant funding in the budget for the health system, another increase in core spending of over $1 billion. That will enable us to recruit more, to do enhanced community care, to increase the number of beds, to advance the digital projects which we're doing. So all the different aspects of it, and extend universal care, by extending the free GP to 6 and 7 year olds, other steps that have been taken. So I guess it's an ongoing.
Sorry, Mr. Watt, just in relation to the overall expenditure on its implementation today, both by the department and the HSE, can you give us them figures?
The overall expenditure on Sláinte Care?
Yeah.
So, I don't think, Deputy, I don't think you can separate out spending to improve capacity within the system, to improve the number of people employed in community settings, improvements in GP service. I don't think you can separate the overall health budget and improvements in the overall health budget and say they are Sláinte Care. Because in effect, I see now that the overall reforms and the enhancements, so over the last number of years, it's 2 to 3 billion which has been allocated ultimately, I think, to measures that could be labelled as Sláinte Care, because some of the aspects of Sláinte Care, like enhanced public capacity. Now, we've already mentioned in relation to Deborah Connor's question, the increase in staffing. So we've increased the staffing very dramatically. A lot of that is Sláinte Care related. We've increased the number of beds by 800, increased the number of ICU beds. So these are all aspects that are around enhancing capacity, and then some of the e-government initiatives. So it's not, but it's actually something we can reflect upon and come back to, because I think it is. It's an interesting question about how much we actually could earmark for it.
But I think for the Public Accounts Committee, if we can get an understanding in terms of the Sláinte Care programme, the implementation strategy, what budgets, what type of expenditure is associated with the different items that you've raised previously, in terms of increased capacity, additional beds, capital projects, resources, recruitment, etc. In relation to the public hospital waiting lists, when does the department envisage that we will resume to an acceptable level?
Thanks, Deputy. So there's different aspects to the waiting list. There's the outpatient waiting list, where there are over 600,000 people now waiting. There's the inpatient and daycare, which is 75,000 people who are waiting. We've had a structural problem with waiting lists. We're making some progress before COVID. The number of people waiting for longer than 6 months in terms of inpatient day cases have come down. So it's a challenge in terms of how to...
I rephrase the question. So as of the 30th of November, we have 897,000 patients currently on some form of public hospital waiting list, and that was published by the NPT last Friday. So I suppose my question is, what are we doing to reduce waiting lists in the coming years, and what is the department, what does the department envisage to be an acceptable level?
So I don't think people waiting beyond a certain time is acceptable at all, Deputy. So I think people waiting for longer than 10, 12 weeks for a procedure for an outpatient consult, I don't think it's acceptable. So I don't think there's any acceptable waiting beyond a certain period. There'll always be people who have to wait a few weeks. Excuse me, but I think over a certain period. Just in terms of the numbers, though, because it's interesting when you look at the numbers. So there's over 600,000 people for outpatient consultations. In 2019, the last year before COVID, there were 3.5 million outpatient consultations. So there's a number of those 600,000 who are waiting too long. Thankfully, a lot of them will be seen quickly. So there's about 200,000, I think, that are waiting for more than 6 months, and that's out of a total of 3.5 million. In terms of the inpatient and day cases, the IPDC, there's about 1.3 million procedures a year. There's 75,000 people waiting, and there's about 30,000 people. Just introduce the point, because it's important to look at. So the waiting list, in effect, for people who are waiting too long, it's probably about 5-6% of the overall delivery in any given year. So the question then is, how can we increase capacity, increase activity to ensure that people are not waiting longer than 10, 12 weeks? So it involves an enhancement of capacity, but against the enhancement of capacity, there are more people every year incoming and flowing onto the list looking for care, primarily but not exclusively because of the demographic changes, because of the demographic structure in society. So the challenge, I guess, there's a number of different challenges. How can we increase productivity? How can we increase activity in the public system, and how can we access the private system as well to get more activity? Because the private system has volume, has capacity which we can access. So that's a real challenge for us in terms of that.
Just in relation to the private system, we talked about universal healthcare. What are the department doing in terms of working with the private providers at present?
So we have Deputy the NTPF. And it's set out in the vote aspect of vote 38. There was, I think, 100 million allocated for 2020 and 80 million was spent. Obviously, COVID impacted upon that. For 2022, the government have allocated 150 million for the NTPF, so that will increase the number of procedures they're able to purchase in the private system. We also have...
Mr. Walsh, are we working?
You have 2 minutes left, Deputy.
So we also have the safety net procedures, which is about the critical time-dependent care, which is non-NTPF, and a lot of people are being treated in private hospitals. Last week we occupied 1,800 beds in a given week. So a significant number of people are now getting procedures. And so the plan is to extend safety net for a period ahead, particularly if we're dealing with another surge in the hospital system, and increase that. And over time.
My time is short. Just one final point, and this is following on for Deputy Nessa Horrigan's comment, just on the oversight the Department of Health has within the HSE's capital and estates programme. What level of engagement do you have with the HSE in terms of delivering projects?
Thanks, Deputy. Like, we've got they have delegated sanction to deliver the capital projects in line with the National Service Plan, and they have a budget. But there would be significant engagement, particularly on the larger projects.
And do you rate performance by the HSE in delivering projects?
Yeah, so the HSE has a scoreboard, which their board looks at every month.
Does the department rate the HSE in terms of delivering on projects? Because what they publish within their service plan sometimes isn't delivered. And is there accountability?
Yeah, so there is, Deputy, that the CEO would account to the board of the HSE and in turn account to the department and the minister. So absolutely. So there will be conversations. We've monthly performance reviews and then quarterly reviews involving the minister, where we assess the performance of the HSE and challenge and get feedback and then work in terms of how we can improve it.
The reports published, Mr. Watt, in terms of the review.
Yeah, I think they are. Yeah, I think
the delivery project.
I think the minutes of those meetings are published. Yes.
And are the projects identified during that meeting in the minutes?
So the reviews would look right across the spend of the HSE and the different programs and activities they're implementing. So the level of detail definitely would depend. I'll have to check that. The level of detail of those meetings, I'm not quite sure. Because it's the larger projects, certainly there would be discussion about the larger projects and progress on larger projects.
I would even say the smaller projects are equally as important. I have locally here in Mayo University Hospital an expansion of an ED department. I got a timeline of 2026, Mr. Watt, 2026. So I'd love to review the HSE capital and estates program and see what level of resources are working on these type of projects, because it's unacceptable to say that it'll be 4 years time, 5 years time, by the time anyone in Mayo University Hospital will get access to an additional ED department. And certainly, while it's great to get approval of funding, 8.4 million, it's the delivery of the project which is causing huge issue. And ultimately, it'll be reported back to the Minister. But if the HSE estates and capital team aren't accountable, I think that it just falls down. And certainly, I have an issue with that. And Deputy Horgan raised that with you previously. Who is making the decisions here? Is it the HSE or is it the department?
Just very brief answer, Mr. Watt.
Yes, so as I mentioned earlier, so the HSE are responsible for delivering on the projects. There are many different projects, and there are many projects that have been delivered. I can't comment, Deputy, on the project you're talking about in Mayo. I don't know the details of it, but it's a reality of building any project that there's a delay that takes a number of years. Now, we're always focused on trying to accelerate project delivery because it's not satisfactory, but it does take a time from conception, design to procurement and then actual delivery, and depending on the scale it can take. But I think the wider challenge for society in terms of how quickly it takes us to build public projects is a wider issue.
Deputy McAuliffe.
We're not going to and to continue Deputy Dillon's point around the, I suppose, the transparency and the oversight of the delivery of projects. I know one that you may also not be familiar with, Mr. Watt, but you might come back to me with regard to an update in writing, is that of the Finglas Primary Care Centre. And we know how important primary care is in the area, and certainly the HSE have been doing a lot of preparatory works in regard to the site. Unfortunately, the site the project has been dogged with planning delays and other issues. And as I'm sure Deputy Dillon will advocate for the capital projects in his area, I would ask you to continue to look at the primary care site in Finglas and to ensure that an area which has a real need, has a very low number of GPs based in some parts of Finglas, is delivered to the community, so we can tackle not just the GP waiting lists and issues there, but also the issue around sort of more holistic health. And I had a great, I won't say pleasure, but I had to attend DDoC with my son in the Coolock Primary Care Centre there last week, and I have to say I was quite envious of the facility which they have. So if you want to take that on board, Mr. Watt, I'm sure you don't have a project details in front of you at the moment, but if you could take it on board, I'd appreciate it.
Deb, look, I as I mentioned, I think earlier, we've 38 new primary care centres have been delivered since 2018. I'm familiar with the one in Coolock, and there's one in Ballybock I'm familiar with too. There's absolutely fantastic facilities. As you appreciate, Deputy, I'm not in a position of influence here and lobbying on behalf of whether it's Finglas Primary Care Centre, which I'm sure has great merit, or Deputy Dillon's project in Mayo. But look, we will come back to you on it. It is, I think, I have seen it on a schedule. And hopefully we can get it up and running. And it's absolutely critical to have the infrastructure there to provide a proper space for the different teams that I mentioned earlier. The community networks and the integration, the community intervention teams, the teams for chronic disease management, and the teams for older people. That's really absolutely important. And particularly, I know that part of the city well myself, and the demography is such that there's a lot of demands placed on the system as that generation gets moved on, and there's a lot of pressure on the system. So absolutely, I think that's earlier Deputy Dillon was asked about Sláinte care. Like a really important aspect of what we're trying to do is to provide that care in the community home care supports, but care in the community to ensure that people don't have to go to ED and then they can get out of the hospital system as quickly as they can, because a lot of people shouldn't be in these acute settings, you know.
Yeah, thanks, Mr. Watt. As I say, it's a case that makes itself. I want to turn to the issue of the registration of births and deaths. And while it is primarily a HSE function, I wonder, are the Department of Health concerned with the very significant delays which appear to be emerging as a result of COVID and then the cyber attack? We are seeing delays in Dublin of up to 11 or 12 weeks for people registering births and deaths. And that has a huge knock-on impact in terms of people's ability to avail of state services. So, for example, it could be about getting access to your local GP, it could be about processing probate, and it could be about applying for a passport. And I think TDs across the house in Dublin are seeing very significant delays. So I might ask you to expand a little bit on the solutions to it, but I wonder at the moment, are the department concerned about it? Are you aware of it? Have you captured what the delay is and the number of people impacted?
Yeah, definitely. I understand it can create a real problem for people, particularly managing estates and probate and all. But to be perfectly honest with you, apart from knowing that there's an issue, I'm aware that there is an issue and delays. I don't know anything about the you know, I know it's partly COVID related, I guess. Why is that? I don't know. And what we might be doing about it, I honestly don't know. But I will come back to you, Deputy. We'll find out. Like, is it the sense that people like I know that the death situation, I guess, is a function of just the challenges the system faces. But in terms of births, is there like people have to in person register the child, or is it in the hospital setting? Is it? I don't know enough the detail, but let me look into it.
I suppose it's more the governance of the service that I'm thinking about myself as well, because I suppose the service is provided by the HSE, but the question is, there's a very significant failing here on the HSE to be able to process what is a very important function. I suppose my question is the department concerned that there is such a failing happening and that it's having such an impact?
Yeah, definitely. Look, if it is, I'm just not aware of the issue in any detail to say anything back to you, which is meaningful. But I will. Obviously, if there's a delay, that will have the impacts you mentioned, and those impacts for individuals could be for families could be quite serious and quite disturbing. So, look, I will look at it and come back. I don't sort of fully understand what's the cause. I can see the difficulties it could lead to, but I don't quite understand what's causing the delay and whether there's a plan in place. There might be a plan in place to deal with it by the HSE. So I'm not going to say anything, because they might be looking at it, they might be putting in place, but I just don't have the details.
Well, you're not alone, Mr. Watt. I believe there's 11,000 people that are caught in the situation, and many of them, when they contact my office, they're not aware of why the issue is. And we all understand that the cyber attack had a crippling impact on the HSE's ability to administer data and their IT systems. But what is of real concern is the idea that there are private companies that are now making services available so that they can register births in offices outside of Dublin, so that they are making that service available to people in Dublin at a cost above what the state charge, so they can effectively queue in an office that has a lower demand outside of Dublin. And I just think that's a huge failure of the state. And while I appreciate it's a delegated function to the HSE, I'd ask you to take from this meeting the idea that we need to examine what's happening here, that the department need to be setting targets for when the HSE should have deaths and births registered, and where they fall below them, that there are penalties. I imagine from what you're saying that there's no specific SLA regarding this area. Are there any specific targets that are set? Are there any specific measurements which the department give to the HSE in terms of the administration of this function?
Yeah, thanks, Deputy. I'm sure there are targets. Be amazed if there are not targets where there's a commitment to register within a certain time frame. I imagine that is part of the agreement, or at least the understanding
between the system and the entities that do this. But let me come back and check on that. I'm not sure exactly. Obviously, we're not doing well at the moment. So that's not good enough. But the extent of the reasons and then what actions might be taken, I just don't have visibility on it. So, but there would, the normal course of events, there would be a commitment to do it within a certain time frame. So I imagine there is an SLA or there is a target, whether that's explicitly written down or understood. I'm sure it is there, but let me check and we'll come back to you. We'll come back to you with enough.
I very much appreciate if you could give us a specific written correspondence on that, because I think it's a number of deputies and senators in the House have real concerns over it. And I say it's not just the emotional trauma of going in and trying to register your mother or your father's death, and then having to go in again and again and again, and each time being unable to do it. It's also having a practical impact as well. And I think my concern would be particularly for early years, for the registration of benefit, child benefit. So I think it's something the department need to examine, and we need to make sure that the HSE, whatever their difficulties are, they need to be resolved. And as I say, if private companies are able to offer a service where they can get a birth cert in another HSE office elsewhere in the country, then the HSE should be able to link those two things together and ensure that people can, perhaps whether it's online or whether it's in person, avail of those additional resources that seems to be available within the current system. But I appreciate you don't have the information in front of you, Mr. Watt, and I very much would appreciate a written response on it. Thank you, Chair. That concludes my contribution.
We'll come back to you, Deputy. I think there's a role for the Department of Social Protection as well in terms of, so between us we'll come back on it. Yeah, we'll come back on it.
The difficulty is that the Department of Social Protection very clearly stated it's a HSE function. The HSE are saying that they're addressing it, but the issue is not getting solved anytime soon. And that's why I'm, I suppose, looking to you and with somebody with overall responsibility for the delivery of this service via the HSE. I would ask you to step in here and to try and take some action on it.
Yeah.
Thank you.
Thanks, Deputy. Thank you. Will do. Will do.
Just to revert back to the Children's Hospital, Mr. Watt, for a few moments. There's a few things we have established. One is that we're about 60% of the way through the project in terms of the financial costs, and 873 million drawn down by year end, by Christmas, by the contractor. And you mentioned in relation to the 1.43 billion that was budgeted, that we're now at around the figure of 1.7 in terms of, the time has moved on and the increased costs due to that in terms of construction inflation. And just if the work on it, and it's actually in the figures that you gave, it's the back end of 2024 that is to be completed, 2024. So that's to say 3 years. So at 4.5% construction inflation, and I'm being probably a bit conservative here, that you're looking at in the region of about 250 million extra on construction inflation alone, given that. And then there's the claims. And then there's the claims on top of that. And in terms of the total claims between now and the completion of the contract, I mean, obviously, you're going to say commercially sensitive, but are we talking about a figure there in the region of hundreds of millions or tens of millions? Just briefly, because
thanks, Chair. As you know, Chair, I'm not involved in the day-to-day management of this project. That's delegated to the CEO of the board. So I'm not dealing with this on a day-to-day level. And I think so these type of detailed questions are just not within my scope to answer. And I've tried to be upfront with deputies today. I'm here to discuss the vote. We haven't discussed it at all.
Would you accept that?
Really, in terms of the 4.5%, I think the 4.5% relates to the price increase by 2019, and I'm not sure, Chair, the formula then in terms of, so that's the price level increased by 4.5% above a particular benchmark in 2019. So if the price level continues to go up,
I'm not sure exactly how that formula works, but we can go back to you on it. But also, it relates to a part of the contract. Okay, it doesn't relate to all of it, because the materials element will be one part of it, wages are another part of it. So I'm not quite sure of the proportion of the cost of the value left,
and could I ask
how much of them would be affected by the inflation adjustment. I just so I don't know the actual application of the formula in precise detail. And I don't. In terms of the claims, we've set out a note for you in relation to the claims, which I think is in detail of the there's a lot of information has been provided to the committee in terms of the value of the claims. If I can get the note here in front of me, a lot of the claims are settled for an amount. I think Minister McGrath gave the numbers recently to the Dáil, so they've been settled for an amount, and then there is outstanding claims which are quite significant.
How many are outstanding, Mr. Watt? How many are settled and how many are outstanding?
So again, Chair, like as I said to you before, I'm not in a. I think it's really best to get into the detail of this contract, the type of level you're talking about. If the representative of the board are asked to come here and talk to you about the detail of it, let me just check. So there's.
We had a figure previously of 200 settled, as I recall it, out of 700.
There's a large number. Large number are settled. Large number of claims are settled, but there's hundreds of claims which are outstanding to a significant amount of money. I think it's in the note that we did send you.
Okay.
I just can't put my hand on it here. Hang on now. Let me just check. So there are significant claims of a significant amount.
Okay, just to come back with that, with the number that's actually settled to date and the number that are still outstanding.
So there's 920 claims.
920.
With a claim value of over $500 million.
Sorry, can you just repeat that? With a claim value of over?
Of over $500 million, of over 500 million.
Right. $500 million.
And then, so there's a significant amount of them. Over 700 claims have been settled for an amount over 4 million amount. So there's a notice of dissatisfaction has been raised with significant numbers and to a significant value, and they're at various stages of the dispute resolution process, project board conciliation, adjudication, and high court. So there's various significant claims, significant amounts, and various stages of arbitration. But look, Chair, I think in terms of the detail of this, I can't provide any more detail of my remove from this project. But I'm sure that I don't know the last time the hospital board were in front of the committee, but I'm sure they can make themselves available.
So what you clarified there is that there's 920 claims with a value of over 500, in the region of 500 million. Now, can you just move on? In terms of the final cost, and you've said today that you don't know the final cost at this stage, and that's fair enough. So do we take it then that the minister doesn't know the final cost? He has no more information than what you have. Is that correct? Just a yes or no answer for that.
So nobody knows the final cost.
So the minister doesn't know. That's okay. And
nobody knows.
And just in terms of the timeline for the completion of the project, it's the back end of 2024. That's the latest that I've seen in documents that we've been supplied with. Is there a penalty, or was there a penalty put into this contract if it goes over time? Just again, I'm trying to be, and I'm not trying to cut you short. It's just that we are on the clock and we're working to health regulations, and it's important for us today in particular that we do that. But could I just ask you, is there a penalty in terms of if the contractor goes over the timeline?
So the exact detail of the penalty clause, I don't know, Chair, but there would be normal in a public works contract that if there are delays which are due to the performance of the contractor, well, then there might be penalties. But the contractor, no doubt, will argue that any delays are due to a variety of different factors which would impact upon delivery of this contract.
Yes, there was two lockdowns, but there was always There was also an extended period back in the summer of 2020 when that site was closed down, when every other site in Dublin was opened, and when the public health regulation said you could be opened. So we'll put that aside. But what I'm interested in, and the Public Accounts Committee is interested in, is that is there a penalty clause built in there where the delay is on the part of the contractor? And just if you can come back and clarify that for us, because I think it's a very important point. Just, we had a visit out there back in June, and it was informative. But there's three things I took away from it. One was the number of claims and what some of the claims were for, and some of the changes that were last minute changes. And I know everything can't be foreseen, I understand that, and particularly in a big project. But, the huge number of claims, some of them for very small things such as moving a window or changing the partition and different things like that. And I asked the person from the board and the contractor to show me examples of what the claims were. But that struck me. There was two other things struck me as well. One was that I asked in relation to energy usage and what provision was there for to harvest any energy on site. Would there be solar panels? And I was told there was no room for the solar panels. Now we're standing on top of the building looking across it at this point, and we're looking down on terraces of houses that are, that have gable ends of about 6 or 7 metres by 5 or 6 metres across the front. 2 up, 2 downs, and 3-bedroomed semis. And an awful lot of them were covered in solar panels. And here we are standing on this new building, and we're told that there's going to be no solar, no energy harvested in terms of solar panels on it. And again, you come in after this, but am I correct in saying that that none of this was built into the contract? And the other thing I wanted to ask you about was that looking at the building overall, I'm sure the architects, that this will be put into a portfolio and into a very glossy portfolio of the design, and it's one of those wow projects, for want of a better word. This amazing design of this amazing building. I mean, there's nothing like it anywhere in the state. Nothing like it anywhere in the state. But in terms of maintenance, looking at it, my God, it'll take an army of window cleaners alone to keep the windows clean in it. What's the annual estimated cost for maintenance, and what's the situation regarding energy usage? I hope that some thought has been given to this before it is signed off on by the department and by the minister. Can you give me an answer regarding those two issues, energy usage and the issue of maintenance, overall maintenance on an annual basis?
Yeah, thanks, Chair. As I said before, my responsibilities relate to managing the Department of Health in all its facets, including both 38 and all its dimensions. My job is not to manage this project on a day-to-day basis, and I don't know.
I don't expect you to manage on a day-to-day basis.
Yeah,
but as Secretary General,
but I don't know the energy usage of the building, and I don't know. But I can come back to you. We'll come back to you, Chair, on it. You've asked three questions about the claims versus the design changes, and absolutely there is a dispute about, as there tends to be in contracts, that a claim is due to the fact that design may have changed. Of course, that will be disputed, and there'll be issues around that. And then the second issue you mentioned about energy usage, I'm sure it's a energy efficient building. It's built to the highest possible specs. And in terms of the maintenance, absolutely, Chair, it's a massive footprint. As I mentioned earlier, it's I think 4 times the size of Tala Hospital. So it's a massive, absolutely massive footprint. So I'm sure there will be significant maintenance costs involved. But we'll come back to you on those, on those specific questions in relation to energy usage and maintenance.
Just one other very quick question, just in relation to pharma companies and any funding or benefit in kind or sponsorship or money for research or for any particular projects that may transfer or benefit in kind from them to healthcare professionals, healthcare facilities, hospitals, or any entity that's working within the public system. There's, we spend, for example, on drugs, I think in the region of 2.3 billion a year, and it's a substantial amount of money. And a number of other European countries and the USA have regulations in place that if I'm operating a number of practices, of GP practices, for example, and you'll notice that a number of companies now are buying up GP practices, so they could have maybe 10 or 20, and we do know that we have a high prescription rate of drugs. You know, we're fairly, whether that's right or wrong, I'm not medically qualified to say so, but we do dish them out fairly plentifully, apparently according to other countries. We have a high prescription level of drugs in this country, of legal drugs. But the question here is that we don't have any way of tracking this, and there are concerns, and I'm raising concerns here about that, you know, people may be receiving more medication than they need, people may be receiving a more expensive medication than has, you know, than they can get otherwise cheaper. I do want to acknowledge that we've made progress over the years, because it's not that long ago that your standard antibiotic was about €28, and now you can get them for €8 or €9. So I want to acknowledge that work that has been done by the department in that regard. But just in relation to, has there been discussion in the department, or have you discussed this with the Minister, the need to bring in regulations here, that there's transparency, that if anybody who's working within the public system or entities that are attached to the public system or directly within it, that if they are receiving any benefit, financial or otherwise, or benefit in kind from a pharma company, that there's a register there of that.
Thanks. So I think, Chair, you're raising fundamental questions. First of all, in relation to prescription patterns, there is an awful lot of drugs prescribed. I think I have some number ahead of about 60 million prescriptions a year in Ireland under the GMS system. And I don't know if the extent to which that encompasses then drugs under the refund scheme as well. I think it probably may encompass both, but a very significant level of prescribing, and that's a worry if that's inappropriate prescribing. I'd say it's very expensive. Almost 2.5 billion now is the overall cost, and it's increasing 5.5% a year. So it's not sustainable in terms of the cost. It's not sustainable, and the level of drugs being taken is an issue as well. And there are attempts in terms of we've negotiated a deal with IFA, which the government is going to be signing on soon, about an enhanced scheme to reduce the price. But we need to push ahead with more prescribing of generic off-patent drugs and biosimilars and so on. And I think there's a big job of work to do.
The question is, Mr. Watt,
in relation to the pharmacy, like, you raise an interesting question. Like, so there's public health officials, people who work in the public system, who are obviously can't receive any hospitality or any supports or whatever it is from anybody beyond a certain level covered by the ethics legislation. GPs are not public servants, even though a lot of their income is funded by the public system, obviously. I don't know whether the IMO or other bodies have guidelines, ethical guidelines, about ensuring that people aren't unduly influenced when it comes to their prescribing patterns. I imagine that is an issue, but it's a good point. It's a good point.
The question I'm asking you, Mr. Watt, has there been discussion at senior level in the department or with the Minister regarding that people who are either have contracts with the public service or entities within the public service, in terms of that if there is, just a yes or a no, if they are receiving benefit, financial or otherwise, or benefit in kind from a pharma company, from a drugs company, has there been a discussion, yes or no, in regard to a public registration of that?
So I don't know. I haven't had a discussion with the Minister, Chair, but that's not to suggest that colleagues haven't. But the point I'm making is that for public service under the existing legislation are not allowed to receive benefit in kind gifts above a certain level. And if they do it above a certain level, they have to disclose it. I think it's 350 is the limit. So for any public servant, if that's the case, receiving any benefit in kind from a pharmaceutical, they would have to, of course, declare that anyway. Now, and that would be declared, and that would be registered. GPs are not public servants, as I understand it, even though they're funded significantly from. But there's an issue there. I'd be amazed it wouldn't be appropriate for people to receive payments. I don't know what the relationship are between GPs and drug companies, but I'd be amazed if those practices are widespread. But anyway, it's something to look at.
Okay, thank you. Now, there's just anybody who has been in who just want to speak again, just lower your hand. But we do have a number of people who want to come in, so we have a very short time left. So just for 1 minute each, I'm going to allow, in the order that you're in, allow you to come in to ask one question, just so as we round up. Now, we were 5 minutes late starting, so just the first deputy is indicated as Deputy Matt Carty. So just, you appreciate 1 minute.
Thank you, Cahirlock. Mr. Watt will be aware that our committee, along with the Committee on Finance, has spent a lot of time discussing your salary. And the salary for the position that you took up was allocated 292,000. You waived the increased portion of that. Can I ask if you continue to waive that salary increase, and whether or not you believe that a portion salary of 292,000 for your position is appropriate and warranted?
So I was asked to come here today to talk about vote 38, the appropriations account 2020 and related matters. The chair alluded to two other matters in relation to that: the nursing home value for money review, which we've looked at, and the children's hospital. I'm here to answer questions about those matters.
Just Mr. Watt, Deputy Carty, just hold for a second. Mr. Watt, just if you're happy to answer, if you're happy enough to answer the question from the deputy, I'd ask you to, if you're free to say, well, you don't want to answer it either, but if you're happy enough to answer it, I'd ask you to do so.
So you're allowing the question to stand, Chair? Is that what you're saying? So I can answer the question or not?
Well,
is that what you're saying? Because I wasn't brought here to talk about these matters. I was brought here.
Sorry.
And under your standing orders, I think are very clear about this matter now.
Sorry.
About what I'm asked and what I'm not allowed to be asked. So I've not answered the question. No, I've commented on this before. I've no further comment to make on it.
And that's the point. That's exactly the point I was making.
Thanks, Chair. Yeah.
You're free to answer the question if you wish. I can't compel you to answer the question because it wasn't on the invitation. That's exactly the point I was making.
Just to clarify, Chair, the question I asked was Mr. Watt made a public statement that he was waiving the increased salary, and the only question that I was asking is whether or not he continues to waive his salary. Is he saying that he will not answer that question?
That's what he said. Yeah, that's it. Thank you. Deputy Catherine Murphy, one minute.
Yeah, I just want to know, in relation to the PwC report, what was the assumed building inflation in that report? And has that deviated from the actual building inflation that is transpiring now? If you haven't got that information, will you provide us with that information? And just, is the full complement in place of the Paediatric Hospital Board? Earlier this year there were 5 vacancies. Are those vacancies filled?
Thanks, Deputy. In relation to the PwC report, this is a report in relation to the Children's Hospital, is it?
Yes.
Yeah, I don't know what the inflation rate they assumed. I don't know.
Can you find out and come back to us?
We'll come back to you on it, yeah. And in relation to the board, I think we're up to the full complement of the board now. If that isn't the case, Deputy, we'll clarify that. But we have a new chair and we've new members who are on the board.
Good. Thank you. Could you just ask him, Mr. Watt, has full 21 on it at the moment, has it? 21 members?
I think, Chair, it's back up to its full complement. Yeah, we were recruiting through PASS to bring people on. But if that's not the case, I'll come back to you on it. We'll clarify that. But my understanding was that we obviously have a new chair, Fiona Ross, I think is the new chair, and there were additions to the board. So, but there are a number of new people on the board. Whether it's right back up to the full complement, I think it is. But let me check. Let me check for you on that.
Deputy Verona Murphy.
Thanks, Chair.
1 minute.
Mr. Watt, just have a quick clarification there. You said earlier that the Children's Hospital was 55% complete. Is that correct? Did I hear you right?
So I think I said somewhere between 50 and 60% is the completion in terms of the value of the contract. Yeah.
Yeah, I think we need clarity on that, because it's based on the information that you gave into the Accounts Committee on Tuesday. 873 million is to be drawn down, and that would represent 60% of the overall budget. Now, if you're saying it's less than 60%, that would give a significant overrun. If it was only 55%, which is what I think you said, that would bring us up to 1.6 billion. And so you might clarify that then exactly as to what percentage of the project's complete.
So that percentage figure, the drawdown to date is as a percentage of the value of the contract, the estimate that I've given you already.
So
whatever that is.
60% of the budget is going to be drawn down. Doesn't equate to 60% of the project being complete. Is that correct?
So I don't have the exact number here in front of me, Deputy, but
that's in your correspondence. I'm quoting it back to you. 873 million of 1.433 billion, which is, as you say in your letter, is the approved budget for the capital project, and it remains at 1.433 billion. But if it's only, are you saying then that the 873 million that's been drawn down at the year end of 2021 is not representative of the completion stage, which you said was 60%?
We just asked for clarification on that.
Mr. Watt, between 50 and 60% was what I think I said. Well, we can check back what I said. We'll clarify the numbers for you.
Thank you.
Yeah, because there would be a significant up.
Thank you.
In the budget. Just one other quick question, Chair.
I have to move on.
Does the 1.433 billion include what the Children's Health Ireland budget would be?
Yes or no? No. Thank you.
No.
Deputy
so
Munster.
That's an extra 300 million then, Chair.
Deputy Munster.
Sorry, just thanks, Chair. Just in relation to my colleague, Deputy McCarthy, a bit of a touchy subject there, Mr. Watt, in relation to your salary. But can I ask the CNAG?
I'm here to answer questions, Deputy.
Could I ask?
My duties.
For
all due respect, I'm here to answer questions.
Sorry, just hold. Deputy Munster, just put your question.
Sorry, could I ask the CNAG if it would be in order to discuss the SecGen salary for 2020? Would that be in order?
I don't think it's for me, Deputy, to say what is appropriate for questioning at the PAC. Thanks. I think that's a matter for the Chair to determine.
We've dealt with the issue of the income.
Okay, but we could maybe discuss it as part of the 2021 accounts in a few weeks.
Okay.
Perhaps. Just in relation to your decision, Mr. Watt, your unilateral decision to refuse this committee access to the report, even in a confidential manner. The board of the National Children's Hospital had said that they were looking forward to discussing the report and its contents with the committee. Now, if we were to invite them in the new year, would you actually block them from discussing its contents, just as you've refused to furnish us with the report?
I'm not in a position to block anybody discussing the contents of the report. What I've set out very reasonably.
Advise them to do similar as what you've done today. Give no information whatsoever.
Well, first of all, Deputy, without wishing to get into argument with you, I have provided lots of information in written form, lots of information out since 9:30 this morning, and lots of information in advance of this report, and lots of information at previous meetings.
Just an appointed clarification, you refused point blank to furnish us with the report.
I've set out reasons which I think are very valid reasons, very valid objective reasons why I don't believe it's in the state interest at this stage to reveal private confidential details.
And the committee will discuss later about getting access to that report. We don't believe your reasons are valid.
Thank you, Deputy Alan Dillon.
You're entitled to your views,
Deputy Alan Dillon.
Thank you, Chair. Just two questions. Just in relation to the procurement and cost of the vaccination rollout for 2020 and the spend to date for 2021, if you can furnish us with that, Mr. Watt, if you have the figures there, that would be great. Second question is in relation to plans by the department for the introduction of a COVID vaccine compensation scheme. Is this something that the department has made a decision on? I know government published the Meehan report back in December 2020, and one of the report's recommendations was around a compensation scheme to be established. So I'd like to get your thoughts on that. Thank you, Chair.
Thanks, Deputy. Yeah, we're just trying to get the cost of the vaccination program. I think it's about 200 million, Deputy. I think is the cost
for 2020.
Or in total, John, what do we think about it? In total. So I don't have the year broken down between the 2 years, but in total, Deputy, we're looking at about 500 million for 20 and 21, and that might involve some carry costs into 22 as well. The total amount, I think, for the 3 years, we're looking at about $500 million. I'll write to the committee with the exact numbers, Deputy. We pay some of it in advance, but most of it we pay it on delivery, and that would include the COVAX contribution as well.
Thank you.
The advance purchases for antiviral drugs and for future vaccine have be led into procurement and agreement for 2022 in terms of what the budget will be?
Yes. So we have procured, I think from memory, about 25,000 doses of the antiviral drugs. Is that right? That figure, I think, is about right. It's not that expensive, Deputy, in name, but I'll check with you. We'll come back with the exact details. So we've pre-purchased as part of the European Union deal, along with other member states, to pre-purchase these drugs, the antiviral from Pfizer. So we'll come back to you on the figures in relation to exactly what the vaccine spend to date and prospective spend. But obviously, it's evolving in terms of the uptake, and then in relation to the antivirals as well.
Appreciate that.
Thank you. Could I just ask Mr. Watt, just in relation to the booster programme and in relation to the vaccination, just I suppose a comment first, just to compliment the staff, those who organised the first and second vaccination, and the staff, the delivery of it. I had it back in May and I had it in 2nd of July, and I queued for my booster dose on Sunday morning. Long queue, a few hours, but look, it shows that there's a huge demand there for it. But just want to acknowledge the work with the frontline staff. It's absolutely been tremendous. Just there's been some talk about that there isn't a great demand and we may have vaccines spare. And just two questions around that. One is that have any vaccines passed their best by date that may be of no use? That's one question, because hopefully that ones we can't use or where we have a surplus, that we're sending them to those developing countries that need them. But the second thing, is there a serious plan to ramp it up? Because I think there's a huge demand out there for it. But I just want to acknowledge the work that's done in that regard.
Thanks, Chair. Thanks for those comments, yeah, and also to mention not just the frontline workers, but also the other staff, the staff doing the negotiations, the administrative staff, the people in health and the HSE, front and non-front line, who are involved in all this. It's been an incredible public health endeavour when you think of the amount of vaccine that has been administered. So we're doing everything we can, Chair, to ensure there's no wastage. So any doses that we have, which we procured, that might be going out of date, we'll be donating that to other countries. Of course, there are always some wastage, as you know, at a local level. It's always possible, but obviously that's been kept to a minimum. But everything has been done to ensure that the supply we need, we use, and that if we've surplus supplies, that it's donated to other countries. So that's the policy. But I don't think there's been a significant wastage of any deliveries that we've received. But we have diverted prospective deliveries that were due to come to Ireland to other countries, particularly during the lull between the end of the main second vaccination programme and then Deputy Dillon asked about the vaccinations compensations committee. I didn't come back to Chair, if I may. So that's something that is something that's the department has committed to doing, and we're going to have to look at that.
At the
Deputy, absolutely. And there's one final point, just Chair, if I may. So Deputy Munster asked about the dental issue. So we are actually this week engaging again with the Dental Association in relation to changes to the DTSS to reflect the challenges that it currently faces. I think I mentioned that we were engaging early next year, but in actual fact, engagements, I understand, will be taking place this week.
Okay, thank you. So I want to thank the witnesses, Mr. Watt and his team from the department. and a staff member from Deeper as well, for the work they're involved in preparing for today's meeting and for attending. I'm conscious to the department that you have faced unprecedented challenges for the best part of 2 years. We're probably facing into another difficult year, and hopefully we can get through that. I just want to acknowledge the work of the staff, everybody. I mentioned the frontline staff. I did mention as well that the admin staff and everyone else behind that. I want to thank the Controller and Auditor General, Seamus McCarthy, and his staff for attending and assisting throughout the year. It's the last meeting of the year, and on behalf of the committee, I also want to take the opportunity to thank the Secretariat, Sarah, this is dangerous mentioning names because I leave out some, Sarah, Owen, Pat, Sam and Shane, for the service they provided, and for Martin here, the committee clerk, and just to wish the health service staff all the best for the Christmas and the New Year. So it is agreed that the clerk seek any follow-up information and carry out any actions arising out of today's meeting. And there is a few. I know it's a fairly robust. The meeting was fairly robust, and there's a lot of questions. And I know that you haven't all the information to hand, but it's agreed that the clerk will follow up, and as always, the department will supply that information to us. That's agreed. Thank you. It's also agreed that we note and publish the opening statements and briefings provided for us today. Agreed. Thank you. So the meeting is suspended till 1:30, when the committee will resume in public session to consider correspondence and other matters. So I'd ask members to be mindful of that. We'll try and start back at 1:30 sharp. Thank you.
Thank you, Chair. Happy Christmas, everybody. Take care.